Good afternoon, everybody. I guess it's been quite some time since morning that you all patiently waited. But I promise you, by the time I'm done, you guys will be 10 years younger. Do you guys want that? How many of you want that? To be 10 years younger? Everybody. So everybody wants to be young, right? So I want you guys, because I see a lot of younger faces back in the audience, pull out your phone and download an app called Daily Dozen by Michael Greger. And then he wrote a book called How Not to Age. Since you're all Ayurvedic people and the professor talked about how food is tightly linked, I am a lifestyle and longevity expert consistently delivering disease reversal through research. And if you see where my CMD is certified medical director, where one thing that India should embrace is that not send your parents to a old age home. The moment you send older people to old age home, there is no love. When there is no love, there is no life, and it's lost life. So I wrote a grant that never got funded for technical reasons called Stay Home, strategic team activities yielding high outcomes and minimizing events. Please, that would be the greatest challenge for the society, and old age homes must be discouraged. But I want to thank Dr. Tanuja and Dr. Goel for inviting me here, and I'm motivated by Dr. Vyas and Dr. Bhatt when they came to Hyderabad and I spoke about heart disease reversal. But the reason I'm standing in front of you is because of a dynamic young Ayurvedic surgeon, Dr. Reshma and Shubhangi. And Dr. Gopinath was there to take care of me, and I'd like to thank Dr. Vyas and Bhatt as well. And I was inspired by Dr. Bhatt, and I want to invoke Rigveda, Jivama Sharada Shatam, Pashema Sharada Shatam, Nandama Sharada Shatam. I'm sure you all know this better than me. But going through this for the morning, I thought ITRA should be transformed. The name should be like Integrative Transformation through Regenerative Ayurveda. And ITRA should inspire, transform, rebalance, and awaken. And my talk would be advance, or somebody can take. Oh, okay, I got it. So there is a current reality that you all know, and I'm going to give you guys, I can't stand at one place and speak. I think I'm kind of...
Hello, can you all hear me?
Kind of like this kind of an approach where I can see people and it's too... So is that okay, sir? Can I stay here? So the current reality, you know that you're all aging, and how many of you can sit and then get up? That's the beauty. If you can actually do that, and you can really age well. It's called sarcopenia. Anybody above 30, you lose muscle each year. And the quadriceps are the muscles that older adults lose, and they cause falls. And it's called sarcopenia. And what are the two one that actually changes the dynamics of the entire pathway. So this was published in 2025 about looking at the challenges of how you can improve. But what we have achieved by people aging, improved quality of life, reduction in infectious disease, life expectancy, critical care focus. But what has happened is there is social inequalities, economic burden, strain, and chronic disease, multimorbidity. So there are a lot of factors that go into it. I have 30 minutes, I have 60 slides, but I'm happy to share all this, but I'll just say that you got to kind of help early diagnosis, give good nutrition, have a safe environment, and create a very age-friendly society. So how many of you know what blue zones are? If you don't know, look up Netflix and watch that movie. Everybody in those areas lives 100 plus years, and the common factors are very simple. They eat whole food plant-based diet predominantly. They sleep by 10 o'clock. They exercise every day. They don't smoke and drink alcohol. They have strong social connections where 3-4 generations live. And none of any place in India was part of blue zones. In America, it was Loma Linda. And why did Loma Linda, California become a blue zone? It's because 70 Adventists live there who are very whole food plant-based. And then they actually don't work on a Saturday, it's only family. And the same Dan Buettner actually created a blue zone through research and showed that you can actually prolong age. So with lifestyle, which are the 6 pillars I'll talk about, you can reverse your aging. I test for reversing the aging. I actually do what is called life and age. We have tests in the US, we do that and show people. It's very important that, so these are the guiding principles in American Geriatric Society, and you all can read it, but basically you take the family and patient into consideration, look at the evidence. Should we do anything that improves the function and quality of life? And if it doesn't, don't do it. And then you kind of have to do prognosis, and you align with the people and what decisions and care that you're supposed to give. You identify and communicate with the patients, and you decide or you start or stop. The point I'm trying to make is, when I manage an older adult, I call it my MP4 model of care, to make it funny. I look at the acute disease, the chronic disease, patient values and preferences, the family values and preferences, and I throw that into my jukebox called the microbiology of the situation, the pharmacology, the pathology, the physiology, the psychosocial. And the song that comes out is function, quality of life. I want you to understand that if anything that impacts the function and quality of life, I am going to do it, fight to any extent with any insurance to make sure it happens. So these are all the age-related changes. This is a busy slide, and there is muscle mass that decreases, heart rate decreases, pulmonary vital capacity, there is renal mass, and this is very important that a third of your nephrons are gone when you hit 65. So it's important that older adults drink 3 to 4 liters of water and then adjust the medications based on the renal function or the GFR. Endocrine, I see that a lot. I actually do a lot of hormone replacement therapy and have several cases that you actually reverse aging when you do it right. And eyes and immune and skin. So the important thing about skin is you got to do hydration. And when does actually the aging start? If it's musculoskeletal, it's about 30 to 40 years, and then bone is about 45 to 50, cardiovascular 30 to 40, pulmonary. So these are all the things that I hope the organizers can share with you. I don't want to go through that. I'd like to respect the time, and we're already delayed. But the point I'm trying to make is that you age every day. Age is tetanus is one vaccine that must be given to all older adults 65 and above every 10 years. Pneumonia vaccine, shingles at 50. So these are all preventive recommendations. Yesterday I was at Heartfulness Center, 50 to 5-year-old colorectal cancer, never had a colonoscopy. He was my patient at 50, I put him to colonoscopy, no matter what, or I'll at least do a stool test. So you can pick up all these things. So it's important that you do bone density at 65 every 2 years, cardiovascular BP lipids normal annually, spirometry and renal function annually, colonoscopy every 10 years. And I do what is called MOCA or slums test to check for memory, and diabetes, I do that annually because every 5th diabetic on this earth is in India. So we have what is called lean diabetes, and then we have a lot of visceral fat and vision, hearing every year, and check skin at each visit. So the point is, how do I make this happen? For me, medical students used to say, oh boy, they are on 20 medications, they have 10 medical conditions. How do you actually manage this? I said, I have the easiest job on the earth, managing older people. Because I create simplicity from complexity to manage multimorbidity and following the two function and quality of life. These are the two domains. Anything I do, if it affects and improves the function, if it improves the quality of life, I'm doing it. If it's not doing it, I don't care what it is and who it is in front of me, I won't do it. So think about that. So this is like how, after talking to Dr. Gopinath yesterday and Dr. Dubey, your scholar, I changed the presentation. I was up until 5 o'clock trying to correlate Jaravata with the geriatric syndromes. We have a lot of geriatric syndromes that we take care of, like frailty syndrome, sarcopenia, osteoarthritis, urinary incontinence, malnutrition, weight loss. Have you ever heard of how to predict falls by a simple test in 1 minute? It's called 5-chair stand test. So if I sit down here and if I can get up like this for 5 times within 15 seconds and each time increases, the risk of falls increase. So we actually use, and I actually send the thing, we have a slew gems little PDF that I send the organizers that you can have these tools to check quickly and assess the comprehensive geriatric assessment. So translating the American geriatric principles into Ayurveda, I kind of put how you can integrate the patient preferences, interpreting evidence, the prognosis. So if you want how you can determine the prognosis of a human being, there is a website, it's all free. It's called eprognosis.org. There are calculators that you can use. It's for the students, I'm kind of telling you, that you can actually create prognosis. And I think the Ayurvedic equivalent is Ayushya Pariksha, is that right? And then you can manage how you can talk to the patient by creating the clinical feasibility and optimizing the therapies. So again, I connected the AGS multi-morbidity to Ayurveda geriatrics because you were mentioning that you have the vision, so this is all the information that's published evidence that I tied together that you can use and how you can actually promote geriatrics into Ayurveda in a blended model. And I hope, I was talking at one of the policy talks at Kanha, that why can't we have a Bharat Med that actually promotes all the research and all the data from all the Ayush centers across India, and you collect it with a standardized electronic medical record, standardized language, that you get a homogeneous data, and then you can interpret it, and all the PhDs can actually analyze and publish and get grants, and it will be amazing to see that happen, how you can translate from bedside to bedside. So these are some of the ways how you can actually integrate, and this is my model. I used to always say MP4 model of how I used to practice geriatrics, which I said. Some of the common syndromes that they have seen always, this is a theme that happens all the time when you get hospitalized. It's cognitive impairment, frailty, sarcopenia, falls, polypharmacy. For people who want to really reduce pills, there is a nice website that you can go. It's called Deep deprescribing.org. So polypharmacy, when you want to stop pills, you can actually, this is a Canadian website by the government funded. It's called deprescribing.org. There are protocols there, it's all evidence-based, you can really do what you want. I used to make it very simple. If the patient gives me 6 conditions and I see 20 medications, I correlate the medication with the condition. If I don't see a reason, I'll stop it. And I was the medical director for hospice palliative medicine, so hospice is when people are dying. I literally had a lot of people get discharged from hospice after I stopped the medication. So please, anything more than 5 medications in an older adult cause what is called drug-drug interaction, drug-disease interaction. And then you all have to adjust the medication based on the GFR, not the creatinine. The reason any youngster can say why creatinine is a bad reason to adjust the medications, because they have muscle loss, so it's not a right indicator. So you got to do the GFR calculation. So we have a team. When I was at University of Michigan, they were like all the team members, they saw the patient, the geriatrician, the nurse, pharmacist, social worker, therapist, physical therapist, occupational therapist, dietitian, psychologist, speech language, care coordinator, and then we create a plan, comprehensive care plan. I just got this here because I'm going to release my book called Live Well, 8 Habits to Health and Happiness, which is the best thing that happened to me in my life because I practice heartfulness meditation, and for 30 years I've been trying to see. When I first went to learn about lifestyle medicine, which I'll talk about the 6 pillars at Harvard for a 5-day course, I was surprised to listen to all of them, and that's what my grandmother taught me. And all what I learned here is what they're packaging it as lifestyle medicine. And we should be the one leading the show, not them. And I'm blending lifestyle and anti-aging, these are all the 9 hallmarks of aging. But what are the drivers of chronic disease? Inflammation, insulin resistance, toxins, hormones, gut health, epigenetics, stem cell dysfunction, mitochondrial dysfunction. So I'm trying to bring back Ashtanga Yoga, the first 5 steps as for health, and Yama, Niyama, Asana, Pranayama, Pratyahara for health, Dharana, Dhyana, Samadhi for happiness. So I want to bring that one happiness wing, one health wing, and you fly to your healthy living or aging well. So if you see what's the main driver is the inflammation, and that's a published paper recently that increases the risk 4 times and multimorbidity 83%. So what are the 6 pillars of nutrition? Whole food, plant-based diet is good. Vegetarian doesn't mean that you're healthy. One of the bane for human existence in vegetarians is oil. Oil causes calorie excess causes type 2 diabetes. Salt is a killer. So these are some of the things that you should look at. I can debate for the whole day with you on that, with evidence, but whole food, plant-based, very minimal salt. Sleep by 10 p.m. because 10 to 2 your body detoxes. So if you don't sleep by 10, you get inflamed. No alcohol, physical activity, resistance training, resistance, which is like lifting weights, aerobics. Mind-body practices, stress management is meditation. And when you meditate, actually, the telomeres prolong. You actually live long when you meditate. And social connections, the touch, the love. And I kind of wrote an acronym, I'm an acronym guy. Love to bring life. Love is losing ourselves very easily to bring light inside forever. So love to bring light among people and yourself. And this is the 6 pillars that, and then you all know this, the Ayurveda approach to healthy aging, Rasayana Panchkarma. These are all the published, there is systematic reviews, meta-analysis, and all. So for the people who want systematic review and meta-analysis, is they take all the research publications, put it, and then get the best out, and then give you the information. So there is tons of evidence. I'm sure the August professors here would know this landmark study, AYUR, it was a randomized controlled trial, and you can see 95% adherence, 3 months, and they looked at early frailty, basic activities of daily living. There are 6 activities of daily living: bathing, dressing, toileting, grooming. Those are all, we call them ADLs, and then there are what is called IADLs, instrumental activities of daily living, like shopping, transportation, and all that. So they actually did this, phase 1 and control, very well done, and they looked at quality of life, functional status, physical performance, and movement capacity. Can you see there what the theme was? It's about function and quality of life. So you kind of have, they did look at sleep and psychosocial, and overall it was well thought, there was good safety, tolerable, and this is Panchakarma and systematic review, and they looked at the mental health, and when they did the lifestyle modifications, there's direct evidence that there's functional improvement, and we just need large-scale RCTs. And then how do you get that? You can see all the things that you guys do. I can't, you're better than me in all this, what all this does for you all, and how they work and what they do. But I just wanted to kind of put this together, wherein how you can do Rasayana with standard care and what happened. And the outcomes are improvement, quality of life. It's overall like functional gains, sleep quality. So they did meta-analysis for sarcopenia, and they've seen that with comprehensive geriatric assessment that you can actually change the game. So this is what we do. And 2025, the Journal of American Geriatric Society found that even in outpatient clinics, that you actually help and change the game if you have a geriatrics-led comprehensive geriatric assessment. And I'll be happy to help you in all doing that. And which I talked already, patient-centered care. And this is how you can actually integrate Ayurveda into modern geriatric care. And I kind of created a quick way how you can the geriatric syndrome, the conventional approach, and the Ayurvedic integration based on the research. So what's the key takeaways and the future is that it's important that you create evidence. It's unfortunate that all our history was buried or burned over the years, right? And then now they want us to prove the same points again, but that's the name of the game. But evidence doesn't mean that it's the gospel, okay? Everything that's published doesn't mean. People get published for various reasons based on who you know in the editorial board too, okay? So, but one thing, the youngsters, I want you to understand, I want you to get this in your mind. Please write it down. Publish or perish. I want you to make that your life mantra, where in anything you do, please publish. I'm outside, it's 9 years that I'm outside academics. I have a voluntary faculty appointment, but I still publish. Because that's how you transfer the knowledge to younger generations and keep going. So evidence is important. Research, we need to do further randomized control trials, clinical integration. I want you guys to understand from sick care to health care and focus on disease reversal and prevention. And you can actually do it. And I just made this up for Dr. Sage Fellowship, Sustainable Ayurvedic Geriatrics and Elder Care, and how to do it, the challenge, the opportunity, why you need to do this, and kind of integrate it with what you all are, and how you bridge the two worlds, and what's the vision, and how you can do this, and why you need to do that. And I created it for you, based on what little knowledge I have, because I started the Geriatrics Fellowship at the university and ran it for 10 years. So I know what you need to do in order to kind of teach people how to take care of the elderly. But the important thing is, it's very simple, and it's fun taking care of older adults. And these are all the milestones that we take care of as far as caring for the elderly, the system-based care, the geriatric syndromes, and we focus on these three areas in order to take care of the elderly. So how do you translate those? I have kind of patient preferences with Ayurvedic equivalent and kind of trying to integrate that approach so that you will have a classic way of doing that. How do you interpret research, prognosis, again, clinical feasibility, optimizing therapy, and then hands-on skills and training, existing programs comparison. So this is the data map for you to show that you don't have any training programs anywhere. So you should be leading the game, and here's the way that you can do it. And then I'll be happy to support whatever the initiatives, because I feel very obligated now for all the things that I've got from India, graduating, even though I'm 30 years out of India, I wanted to give back to India, and this is the best way I can give back to India to disseminate what I learned. And I love youngsters, because they are the Viksit Bharat, right? So 5,000 years of wisdom we have, one unified approach, 100% commitment can create that. And the references are there, but I just want you all, whoever has the internet here, go to this website called pogoe.org. It's called POGOE. So what is that? All the geriatric programs across the United States, whatever the faculty develop, build, they actually dump it on that website. So you don't have to recreate it. You can use it. It's a free thing. All you have to do is to register, and it's run by the American Geriatric Society leaders. And if you actually create a tool to measure something in elderly, in Ayurveda, they might be happy to publish that over there. So please, and you can just Google SLUGEMS PDF, SLUGEMS PDF, and you'll get all the geriatric tools you need. It's called the 5-chair stand test. Epworth sleep scale is for sleep. So you need to use those tools. You can't say, go and do a sleep study for sleep apnea, right? You have tools that you can screen people. It's called Epworth sleep scale. And there is, for malnutrition, there is what is called snack questionnaire. If they're malnourished, what questionnaire? So these are validated tools that you can use, and they're very simple, and you must use, and that's the language you should talk. Because when you want to publish, they want validated tools, and how many you have used. That's, the St. Louis University created that. And if you want to learn a lot about geriatrics care, online.org is an excellent website that you can actually use for all the resources that you want, and they're all free. They're done, developed, and I talked about the eprognosis.edu. And I hope with this, because in the interest of time, that I just brushed through it, but it's pretty self-explanatory. But if I have to leave some thoughts on you guys of to how to take care of the elderly, please don't put your parents in an old age home. That's not right. Because I've been doing geriatrics for 25 years in the United States, and I'm a medical director for probably, in my 25 years, 30 nursing homes. And one thing that they don't get there is love. And what brings love is your home. So that's one thing very, very critical. And when you start taking care of the elderly, focus on the function and quality of life, which is very critical. And the PowerPoint presentation has a lot of tools and ideas that you can use. And I gave you some websites, but How Not to Age is an evidence-based book that Michael Greger put it together. And 17,000 citations are there, so it's completely evidence-based that you can use and prevent yourself from aging. And I don't believe in aging gracefully, aging well, aging this. I just want to die young. And what are the best ways to do that? You have to follow the 6 pillars of lifestyle medicine. Nutrition, whole food plant-based diet, sleep by 10 p.m., no smoking or alcohol, cut down the oil, salt, exercise daily, and then meditation for stress management, social connections. Social connections, Indians think that my caste people are all together and that's social connections. That's not social connections. Or my Gujarati people or my Telugu people. That's not social connections. Social connections come when you wake up and how you treat the next human being. The person that's coming in front of you, hello, hi, you smile. And then how do you interact with them? The respect that you give. Those are what social connections mean. Not trying to connect with your own people and then saying, I have fun, I have too many parties. That's not going to cut the chase. Okay? So in those blue zones, so it's very important that you all watch blue zones and what they are and focus on these things and then do resistance training and you'll age well, stay well, and die young. Thank you for the opportunity to be here. I hope it was useful and I open to questions.
Thank you very much, sir, for such a wonderful speech on the topic that is reversal of geriatric syndrome, is explaining all the things which is really required in the today's society. So now I will request chairperson of the session, Professor Manjusha Madam, to felicitate the Dr. Gokula Murthy sir with the certificate and memento. Our second speaker of the plenary session is Dr. S.M.S. Samarkand, alumnus of the same institute. I would like to call Dr. S.M.S. Samarkand sir for his speech. Dr. Samarkand is the Director of Postgraduate Institute of Indigenous Medicine in University of Colombo, Sri Lanka. In spite of being administrative work, he has guided more than 35 postgraduate projects in different sections. His research spans are Ayurvedic clinical practice, aging, and indigenous medical system, with over 90 short communications and several peer-reviewed publications in reputed journals. So, without taking time, I will directly invite Professor S.M.S. Samarkand. His topic is Ayurvedic management of age-related diseases and evidence-based approach. So, please.
Thank you, madam, and respected panel of the chair and co-chair and dignitaries of the audience. So, due to the limitation of the time, I got prematurely the chance to do my presentation, as I did my PhD work also on premature aging. It is matched together. So, without any further delay, I will come directly to the topic. First slide, please. Right, the topic is Ayurvedic management of age-related diseases, evidence-based approaches. So here actually I want to highlight now, before me, few speakers talked about the many theories and the basic concepts of aging based on modern and Ayurveda medicine. So I am not going to discuss them in very deep, but I want to highlight only few areas. One is, so what are the diseases that can be cured by Rasayana therapy, and also what are the research so far has been done, and also what are the limitations, and there are some case studies I want to show you. Right. So, according to modern science, so aging is the progressive physiological decline. So, you know that reduce the functional capacity and increase the vulnerability to disease and death. So, actually aging, as mentioned earlier, that is quite a natural process. It is an intrinsic process, inevitable and irreversible process. So, according to Ayurveda, it is called Jara, and which is classified under Swabhavika Vyadhi, that is natural process like hunger, thirst or sleep. So, in Charaka Sanghita Sutrasthana first chapter, it is mentioned the Ayurveda, like there is a definition here. So, according to this, actually the aging also has many facets here. Aging affects the Sharira, Indriya, Sattva, Agni, Bala, Ojas, everything. And there are some determinants which are sometimes outside the body and sometimes inside the body. So, some determinants are called parinama, cellular transformation, and some are determined by the genetics. Many triggering factors are there, which are some intrinsic and extrinsic. Okay, now you know in this era, so urbanization is rapidly progressing, and also environmental pollution is there, and stress is high, and people are more deviated to the social media. So all these can be considered as misuse of sense organs. We say in Ayurveda, asatmendriyartha sanyoga. So mental and physical ill health weaks the homeostasis of the body and resulting in pathological aging. So in Ayurveda it is mentioned samadosha samagnicha samadhatu malakriya. So to be healthy, those factors should be in equilibrium status, that is in homeostasis. When one indulgences those factors, so aging process may start. So the Ayurveda takes holistic approach toward the maintenance of health, of a state of equilibrium of normal biological, physiological, mental and spiritual well-being. That says actually Ayurveda has the option to consider not only the physical health but also the psychological and spiritual well-being also. So Ayurveda aims to restore the balance and ensure the proper functioning of the body, mind and emotion, which emphasize a personalized and individualized approach to enhance health span. So Ayurveda offers to a holistic program including diet, lifestyle, behavioral and psychological intervention. So this is actually included in the Rasayana also. Now in Charaka Samhita Chikitsasthana first chapter, totally devoted for the Rasayana therapy. There are 4 padas there, 4 sub-chapters. So not only the drugs, Rasayana consists of non-drug treatment method also. For example, Achara Rasayana. So that is also a part of Rasayana. So Ayurveda offers that holistic program including diet and lifestyle modification also. And now when we get old gradually, with the age, you can see some doshas become more dominant here. In Balyavastha, that is in children stage, young stage. So Kapha dosha become more prominent here. So there is a natural predominance to have some diseases as mentioned in this slide. And again, when we become to the young and middle age, after 16 years of age and before 60 years of age, so Pitta dosha become more predominant. Then what happened when Pitta dosha become more prominent, some diseases are more common during this age. So you can see some diseases are more common during this stage. So in Vruddhavastha, that is called old age, usually the Vata dosha is more prominent there. So in old age, after 40 years of age, then after 60, 70 years of age, the vulnerability is increased to get some diseases which are Vata origin. So Pakshagata, Sandhigata Vata, the old people usually when they come to Ayurvedic hospital always complain about these complaints. So that means when advancing age, so all 3 dosha are gradually associated with their disease pattern also. When we come to the modern biological sciences, so aging is always associated with some symptoms. So there are some symptoms which are age related. So they have no any clinical significance. For example, graying of hair, falling of hair and wrinkling the skin. So these are age related. But some clinical features are age determined. That is due to only aging process, due to the degeneration process in the body. So I have mentioned here few clinical features: hearing loss, cataract and refractive errors, pain here and there, that is back and neck pain is very common in old age, and osteoarthritis, and chronic obstructive pulmonary disease, which are very common during this old age. Diabetes due to reduced insulin resistance, and depression, dementia, they are very common this old age. And in addition to that, there is a geriatric syndromes containing frailty, urinary incontinence, falls, delirium and pressure ulcers. So all these are associated with this old age. So now what to do for these age-related diseases? As I mentioned before, actually Rasayana is the most beautiful branch of Ayurveda. It is not just a branch of Ayurveda, it is a philosophy actually. It is a way of life. So when you go through all the chapters in Rasayana Tantra, as I mentioned the first chapter of Chikitsasthana, and also there are 3 chapters in Sushruta Chikitsasthana 27, 28, 29 and 30th chapter. There are many methods of Rasayana. So we can use Rasayana to combat the wear and tear or degeneration process of age. And there are some measures, Vata Shamana and Bringhana. As I mentioned, so Vata dosha is more predominant during the old age. So we have to combat the Vata. I can remember when Babu Dwivedi sir presenting his presentation, he mentioned that if Agni is okay, if the function of Vata is okay, so we can live long without any disease. So Vata Shamana and Bringhana also very essential during this age. And we have Dinacharya and Ritucharya. That also have some curative effect. Right? So regulate the normal way of living. So it is very close to biological rhythm. So we can use Dinacharya and Ritucharya, which is mentioned in Ayurveda, and also Sastavruta. So Sastavruta method can be used for healthy aging during the old age to combat the several issues, and Panchakarma, that is biopurification. There are many methods here. For example, Astapana Vasti, that is why it is called Astapana, it has potency to sustain the aging process. So there are many methods we will discuss later on, and to supplementary and complementary to the above methods, we can use yoga and meditation, that is for mental clarity. Why? Stress also related with the aging process, right? When increasing stress, that degeneration process may accelerate. So if we can reduce the stress, we can retard the aging process. So in that sense, yoga and meditation has value as an anti-aging measure here. And just I have mentioned here what is the mode of action of Rasayana therapy. Rasayana actually acts on 3 levels. One is Rasa, the other one in Agni level, and Srotas. So Rasayana, you know the definition, Labho Payu Shasthana, Rasadina Rasayana. If you get the proper nutrition to the body, so we can sustain the aging process. And Agni should be in good state, and Srotas should be in good moving state. When Agni, Srotas and Rasa are in good state, so you can get the benefits of Rasayana. Dirghamaya Smriting Meda, Marogyan Tarunabhaya, you can remind that. So you can experience longevity, and you will have good immunity, and you will have good mental competence there. These are the main Basti. So most effective for Vata disorders in old age, when Vata is become more predominant. For that kind of diseases, we can apply Basti. And Basti improve the strength and nourishment and mobility of the people. And it is very good for arthritis, constipation, and some neurological diseases, and especially osteoarthritis. And Abhyanga. Prior to the Shodhana Karma, Sneha Sweda. So daily oil massage, as mentioned in Sastavruta also, Dinacharya, daily oil massage with medicated oil can be used, and it relieves stiffness, dryness, fatigue, and promotes circulation even. And Swedana also having some curative effect. Mild steam therapies reduce the stiffness, pain, mobility. So it is very useful in osteoarthritis and musculoskeletal disorders also. Then you can realize that not only Rasayana, some related other therapeutic measures also can be used in this old age related diseases. And Nasya. So Nasya cleans the channel in head and neck and support memory, sleep, vision, and it diseases, Shirodhara and Abhyanga. So it calms the mind and improves sleep, reduce anxiety and stress in elderly people. You see, many methods are there. So you can customize the treatment based on the patient's prakriti and also the state of the disease. Based on many factors, you can customize the treatment, and you can select based on the patient's need. And therapies are herbal based. So this herbal medicine plays a vital role in managing age-related diseases through Rasayana and Medya therapies. You know, Ashwagandha, Amalaki, Guduchi, Brahmi, Mandukapanni, Guggulu, Amalaki, Haridra, so on. There are a large number of rasayana herbs that can be used for many diseases that may improve the strength, metabolic balance also. So there are many clinical studies have done on these formulations and which are proved to be effective on these type of diseases, that is age-related ones. So osteoarthritis, improving health and cognition, enhanced stress resilience and supportive glycemic and lipid control even. Many benefits of rasayana therapy when we use for age-related disease. One is holistic and multimodal approach. So when you use the rasayana, now in geriatric care, modern chemical drugs can be used, usually used for some organ targeted. But in rasayana drugs, when we use all the indriyas in the body. So rather than targeting a single symptom or single organ, these rasayana drugs can be used holistically in targeting diet, lifestyle modification and rejuvenation therapy also, and support not only physical health but also mental and emotional well-being also, making it highly relevant for managing the So that is the beauty of these rasayana, and on the other hand, improves the quality of life. As I mentioned, rasayana, not only the herbal medicines, there are some other methods, even achara rasayana and some other rasayana method, so which can be used to improve the quality. So clinical trials show benefits in energy levels and mental well-being in elderly people. So enhance these things. And it has preventive and promotive care even. So rasayana therapy can be used for rejuvenation, and also it has a curative effect also. So as I mentioned, there are two main objectives of Ayurveda, the Sasasya Ujakara and Arthasya Vikarpashbana. So rasayana mentioned in rasayanas to have rasayana effect, and also we can use for curing some diseases. And fewer side effects. So as the rasayana formulation are formulated with herbal materials, each has no side effects, so fewer side effects may be there. Fewer side effects may be there. And integrative so Ayurveda rasayana drugs can be used alongside with the modern chemical drugs. So in that way we can reduce the burden of healthcare system, and each other can be complementary and supplementary to each other. Actually we are using them for some chronic diseases, for example for diabetic mellitus, hypertension and many more. So we not use the rasayana drugs based on the symptoms, but we use the rasayana drugs to the patient. So patient centers treatment mentioned in the rasayana therapy. So emphasize individualized treatment based on prakriti and disease stage, and condition specific evidence. So in rasayana therapy also there is some branch of rasayana, some rasayana drugs specially effective on some diseases here. So we can use, for example, here I have mentioned Nisha Haritaki. So improve glycemic control and lipid profile. So in that way we have lot of rasayana drugs which can be used for some specific disease conditions. And at the same time, so there are some limitations, we have to see the limitations. Quality. So many of the research done in Ayurveda related to rasayana has very small sample size, and the studies are very short term, and there is no strict research methods there. So lack of rigorous methods, so which limits the strength, and there is a problem and issue with the generalization. Interventions. So formulation and methods also vary from place to place, and sometimes it may be varies from university to university. So there may be some differences. So that is a burden, that is a, the restriction to have some homogeneous result, and standardization challenges. So identity, potency and quality control affect the safety and reproducibility. That is also problem with this Rasayana formulation. And safety and interactions. So when we use Rasayana drugs with modern allopathic drugs, in long run there may be some interaction with them. So we have to think about that also. And limited global accessibility. Drugs, but in other countries we doubt that we can find some good quality Rasayana drugs. And integration gaps also. So actually aging is a burning issue. So we can come closer, come together, modern allopathic sector and Ayurveda sector, to have some integrated treatment protocol. So that is gaps is there. And regulatory and reporting issues also associated with this herbal remedies. It's not moving. Please, can you see this is not moving? Why it is not moving? Right, okay. Right. Okay, then you know there are many Rasayana formulation in Ayurveda in the relevant chapters, but I have mentioned here, we have some our examples in Sri Lankan context. There are many Rasayana formulation in are widely used, commonly used and very popular in managing the age-related disease. I have mentioned few here. One is Pramodyapana, that is actually like a neurotonic. It is which can be used for fatigue and neuroprotective agent. And then Divadiya mean in our language diabetes. So we can use this to for the diabetic mellitus patients and to control the side effects. And Madam Pane, that is also Madam mean Jambu in Ayurveda. So we have Madam Pane in, that is in Panaka Kalpana. So it is used in Madhumeha, and we can use it for the complication of Madhumeha. This is a decoction. Again, this is well popular for the neurological diseases, which is in old age especially. And this is also decoction, which is also useful for osteoarthritis and many neuropathies. And Suranimba Arka, that is Arka Kalpana, you know, this is a separate dosage form, can be used for dyslipidemia. And Madhumehari Arka, then Kuchilasara, that is for neurological, and Siddha Jivamruta syrup. All these three are syrup formulations, and Brahmi syrup, and Valpenal Amukara syrup. These are used for neurological diseases, have some memory impairments. And Buddhi Vardhani, that is Saraswata Grita, it is also mentioned in Ayurveda also. Then Chadrakalka. These are limited to very unique to Sri Lankan indigenous medicine. Then Ranahansa Rasayana, I can remember, Professor Pandya Madam also can remember, we had Dr. Yes, this is used for Amavata. And Prameha Gajakesari Rasayana, Lashuna Padma, which is mentioned in Sri Lankan indigenous medicine also. And there are some traditional oil, Siddhartha Thaila, Chandrakanti Thaila, Divyanganadi Thaila, which are very useful for age-related disease. And Kuchilavati, Chandravati. This is very unique drug in Sri Lankan traditional medicine, which is very useful for sleeping disorders and cardiac diseases, especially for hypertension. So it is very effective for fluctuating hypertension. And I have mentioned here few studies. Actually, I got the opportunity to do research on Amalakaya's Rasayana, which is mentioned on the Rasayana chapter in Charaka Sanghita. In this study, I had many publications. Here, this is one of the publication, Pharmacognosy and Phytochemical Study of Amalakaya Rasayana and Anti-Aging Ayurvedic Formulation. Study was done under the supervision of Professor H.M. Chandola. And this is the effect of combination of unequal quantities of ghee and honey. That is also part of my study. And this is effect of dietary, social and lifestyle determinants of accelerated aging. So aging has, as I mentioned before, many factors, but there are many factors are intrinsic. Even excessively use of mobile phone, social media also one day may recognize as an agent for accelerated aging. And experimental evaluation on gastroprotective and adaptogenic activity of Amalakaya Rasayana, that is also related to my study. Then evaluation of antioxidant activity of Amalakaya Rasayana in tissue homogenate of albino rats, a pharmacological study. This is published in International Journal of Ayurveda Research, evaluation of antioxidant potential of Amalakaya Rasayana, a polyherbal Ayurvedic formulation. So, this is another study, evaluation of adaptogenic activity profile of a compound Ayurvedic formulation, that is Amalakaya Rasayana. Many publications are there. I have mentioned here some case studies also on some Rasayana formulation. So, we have not more time to, we don't have more time to discuss all those things. So, finally, I would like to highlight, ladies and gentlemen, so there are various steps to manage the aging process. So, Ayurveda views healthy aging through harmony with nature, lifestyle practices and positive choices that support the body and mind. So, Ayurveda Rasayana incorporate all those things as I mentioned. However, due to limited systemic safety and efficacy studies, concept of aging remains largely theoretical. So, we have to do the research, we have to adapt the very correct research methodologies there. We have to prepare the research drugs on classical methods, then only we can get, and again we have to do the research on very larger sample size, then we can get the more promising results out of the Rasayana drugs. And there is a need for rigorous research to validate Ayurvedic approaches, reduce bias and establish the evidence. A holistic Ayurvedic lifestyle can provide a foundation where modern anti-aging drugs, often ineffective alone, may become successful as part of comprehensive therapeutic programs. So, combining Ayurveda with biomedicine offers potential to extend both health span and lifestyle. So, it is actually very good when we use some medicine for some age related disease. If we can use Rasayana drugs complementary to those biomedicine, so we can get more promising results. So, with this and I have to say sorry because due to the time restrictions I have to do past my presentation. Thank you very much. If you have any queries, this is the time to ask.
Thank you very much, Dr. Samarkon. Now, I will request co-chairperson of our session, Dr. Shodab Dorji, to present memento and certificate to the Dr. Samarkon. Thank you very much. Our third speaker of this plenary session is Dr. George Luis Bera. Dr. Bera is a medical doctor graduated from the Argentina. He is having 26 years directorship of postgraduate courses in Ayurvedic medicine. Presently, he directs Ayurveda programs with the Catholic University of Argentina and the University of Gran Rosario, where he also holds the title of honorary professor. As an expert invited by the WHO and the Ministry of AYUR Government of India between 2018 and 2022, he contributed as a reviewer for the WHO traditional standard terminology on Ayurveda. He is a member of the WHO working group of ICD 11 chapter on the traditional medicine. Director of the Prema Ayurveda Health Foundation, he is presently working. He is a recognized collaborative center for Gujarat University now with the ITRA, and the foundation courses hold top accreditation from Rashtriya Ayurveda Vidyapith and formal cooperation agreement with the WHO. So I will directly invite Professor George Luis Bera for his deliberation.
Just a brief introduction. Now we are going into the evening, not just something like that. In my country, at this moment, the people are waking up. And to reach India, we are 16,000 kilometers from India, in Argentina. And to be here, we need to be, without taking into consideration transit time, 24 hours in a plane. We are very, very far away. And for this reason, we need to think, is Ayurveda a reality in our region? Are Rasayana medicinal plants available there, or we are in other continents, we are very far away from India? That's the objective of our presentation about Rasayana medicinal plants from Ayurvedic Pharmacopoeia of India in the American continent. I need help. Come. To which place? Waiting. Houston, we have a problem. Okay. Okay. Come. Going back? No. Okay. This one? Okay, perfect. Okay, thank you for the help. Just a brief introduction. We are conducting university courses in Argentina for the last 26 years. We are related with the Argentina Medical Association, and we have MOUs and joint certification with Great Rosario University and Argentine Catholic University. And we have, as I told you before, we consider ourselves a bridge between the best of India and to put Ayurveda in the best possible place that we consider that there are the universities. And for this reason, we have different MOUs with ITRA, with Gujarat Ayurveda University, Rajasthan University, and also with Rashtriya Ayurveda Vidyapith, who has provided accreditation, level 3 accreditation for our courses. Okay, we have, as I mentioned before, we have the MOU here with the Gujarat Ayurveda University 25 years back, and with ITRA in April 2022. Just, we know the classification of Rasayana. I don't want to speak a lot about that, but we know that based material uses, we must take in consideration medicinal plants. These medicinal plants, Rasayana drugs, they have positive effects, which are reducing the oxidative stress, reducing inflammation, reducing lipid peroxidation, reduces DNA changes, improves antioxidant enzymes, improves apoptogenic effects, and also improves modulation and having scavenging also activity. Okay, the importance of Rasayana medicinal plants. They have mentioned health benefits and also madam, working. Okay. No, it's okay. Okay, I don't repeat this. It has been mentioned by Dr. Divedi and also other doctors. Okay, the global perspective of medicinal plants. In India, there are at least 7,000 medicinal plants. 2,700 are mentioned in the Indian Materia Medica, and now I guess that we must change the battery. Yeah. Or bring me laptop. Sorry. Okay. Okay. In Latin America, we have a very rich ecosystems. For example, in the Amazonas region, and there is an underexplored relation about medicinal plants. Next, please. Which is Latin America? Latin America is there are 19 countries. In fact, there are 18 countries. No, 19 plus the Caribbean region, which are 13 countries plus Cuba. Next country, next, please. And I don't know if you here in India have this. Where is Wally? We have in our. There are a lot of medicinal plants, but which are there are Rasayana medicinal plants in this Latin American region. Next, please. Please. And we have studied the presence of Rasayana medicinal plants according with the Ayurvedic Pharmacopoeia of India in our region. Please. And we have checked the 10 volumes of the Ayurvedic Pharmacopoeia of India, and based on our findings, we have checked the presence of these medicinal plants searching in official databases. Next, please. The first 10 volumes contain 665 monographies on 519 medicinal plants. The volume 7 and volume 10 includes are related with extracts. Next, please. Volumes 8 contains 60 monographies of 15 medicinal plants described in previous APA volumes, and volume 9 contains 45, which are related also in other previous volumes. Next, please. Next. Okay. Here we have checked in official official information about medicinal plants of our region. For example, there are next go. This is Darwinian, the Botanical Institute of Argentina, which has the information of our medicinal plants. Next. Also the catalog of plants and mushrooms of Brazil, and also the Colombian vademecum of medicinal plants. Next, please. And we also check with the tropicos.org, which is one of the most important websites, official websites, which describes the location of the medicinal plants. Next, please. And first, we have identified the Rasayana medicinal plants in Ayurvedic Pharmacopoeia of India. Later, we have checked with these books and catalogs, and also we have checked that the taxonomy of the medicinal plants has been properly identified, and we have checked if there are positive and negative results about the presence. Next. You know that nowadays there are a lot of medicinal plants available in internet, but we have checked only native plants available in Latin America region, and in some case there are in the Ayurvedic Pharmacopoeia of India they mention 2 substitutes for one of the medicinal plants. In that case we have checked also this information. Next. Some points to have in consideration. There are Latin America is very big, and there are some parts of the continent that has not been explored properly. And also there has been taxonomical issues where there are evolution and discrepancies about the names. And also in some parts it's difficult to match the botanical name with the popular name. Next. Next. Okay, going to the Ayurvedic Pharmacopoeia of India, there are 53 plants in 58 monographies. They were in the Ayurvedic Pharmacopoeia of India. They mentioned that such plants have a Rasayana activity, and we have excluded 11 plants in which in Ayurvedic Pharmacopoeia of India are included in formulas, but these plants has not Rasayana action. Next. Some special situation with Tulsi. It's described in volume 2. It is described also in volume 9, but in volume 2 is not mentioned Rasayana action. In volume 9 is not mentioned any action in monographs about the hydroalcoholic of water extracts. But there are, is mentioned in volume 9 with Rasayana activity. There are discrepancies also in Ayurvedic Pharmacopoeia of India. And Tulsi grows natively in Colombia, Venezuela, and also in some countries of the Caribbean region. Next. Atmaguta, Mucuna pruriens. I want to mention something about that. Next, please. In volume 3, they say that Mucuna pruriens hook, synonym Mucuna pruriens Becker, family of Fabaceae. They have a Rasayana activity, and in volume 4, there are other mention, other name. Next, please. And going to tropicos.rg, we have different options about Mucuna prurita. Next, please. And you could see in the in the 4th column, there are a lot of different types of Mucuna pruriens. Only the first one, which has the strong sign of exclamation, is the validity form. Next. And if you go then to the distribution, then you could see that it's officially identified in different countries. For example, Mucuna pruriens is also in my country, in Argentina. Next, please. Here is, we have checked the 53 medicinal plants with Rasayana activity, checked in each country, and you could see that there are 24 Rasayana medicinal plants in the Colombian Caribbean region, 22 in Brazil, 21 in Mexico, 20 in Costa Rica, Guatemala, and Honduras, and then you could see that there are at least 10 medicinal plants with Rasayana activity from Ayurvedic Pharmacopoeia of India in all the countries of Latin American region. That's very important. And this, I want to stress, these are medicinal plants which are natively from each country, not introduced, because, you know, every time that we have students, doctor, is it possible that we bring ashwagandha seeds in our baggage and then plant when we are in our country? This is one ecological disaster, but every year we face some questions from our students in this point of view. Next, please. Okay, some very few examples. For example, Carnashpota, in 19 countries, there are in all the Latin American countries. Next. Eclipta alta, in 19 countries. Next. Apamarga in 16 countries, not in Argentina, Bolivia, and Uruguay. Next. Brahmi in 19 countries. The only exception, and in this case we consider that we lack proper information, because Brahmi is all over the world, almost all over the world, but in Colombia they don't found Brahmi. Vacoponieri. Next, please. NIM, as a directa indica. We have in our cities, in our city, for example, one of the trees is a NIM tree, but it's not in Bolivia, Chile, Peru, and Cuba. Next, please. And this is from a very important document which has been presented. It was the topic of research one from WHO when this institute was a collaborative center from WHO. And they mentioned the most important Rasayana medicinal plants, and you could see in green which the medicinal plants with Rasayana activity which are available in Latin America, and also in yellow those medicinal plants which are legally introduced as extracts in my country, in Argentina. Then you could see there are 10 medicinal plants, at least 8 of them are available in my country. Next, please. Okay, important. These medicinal plants are available legally imported from India. They are available as magistral pharmaceutical preparation ordered by the medical doctors. In my country, the medical doctors are not allowed to sell medicines. Only the pharmaceutical doctors could prepare the medicines. And we are working in the medicinal plants that are legally imported was dyed extras 521. And we have very good clinical results reported for the patients to the medical doctors. But we have also, there are some risks and dangers. Next, please. Next. You know, I couldn't believe it, but during the last year in Latin America, they are promoting ashwagandha as a mushroom. If one side are mentioned ashwagandha as one mushroom, you know that all is a fake, all is a lie. And I could show, this is in Instagram, in the right you have the terms in Spanish, and I have translated and highlighted the term ashwagandha as more. Next, please. Same, other mushroom native from India. Next. And of course, if they are mentioned that this is a mushroom, you are not know which powder or whatever is could be in that product. And also another adaptogenic mushroom, ashwagandha. Next, please. And also, for example, here they say the type and concentration of the extracts are not mentioned. They say extracto in capsules, extracts in capsules, but you don't know how is the concentration of the extracts. It's totally different, 20 to 1, 10 to 1, or 5 to 1. And this is very important because we are, as medical doctors, need to know which is the prescription. Next. There are very important points that we must have in consideration due to this presence of Rasayana medicinal plants in Latin American region. First, the people will trust medicinal plants that are growing locally. Second, it will simplify the regulatory process of regulation. 30 years back, when I approached my local FDA for the registration of Ayurvedic remedies, the top person of the local FDA, Argentinian local FDA, she said to me, "You will walk upon my dead body before any Ayurvedic medicine will be registered in Argentina." That's true. That's true. I want to share also that in the last Ayurveda Day that we carry out at the Argentina Medical Association, at that moment there were the new director of our local FDA. Things have changed, but of course it will be much more easier to have the approval of one remedy with medicinal plants that are growing locally, a medicinal plant that could be imported from other countries. Also, it could be possible local cultivation. We know we are speaking, we have the world has discovered medicinal plants, but medicinal plants are, it will disappear in some period of time, because if we are using medicinal plants, we need to have local cultivation for the renewal of that. Next, please. It's very important to have alternative resources. It will help for the protection of biodiversity. It will help for the global access of Ayurvedic remedies. They will produce trade opportunities and more links between countries and a lot of things. Next, please. Oh, the conclusions, going rapidly. More than 55% of the rational medicinal plants mentioned in the Ayurvedic Pharmacopoeia of India are available in Latin American region, and also there are some plants that now are legally imported in, at least in Argentina. And this will help also, of course, for a better health, for better care of the people, and also it will help for the registration of the Ayurvedic medicines with our local authorities. Next, please. And I think that it will allow, and we could contact with this one world, one family, Vasudha Kutumbakam. Next, please. Thank you. And once again, I want to express gratitude to India for protecting Ayurveda during millennia, expanding Ayurveda, and also for sharing Ayurveda with all the people of the world. Thank you so much.
Thank you very much, sir, for such a nice deliberation and some different topic, which is also very much important. Now I will request Dr. Manjusha Rajgopal Madam to present a certificate and memento to Dr. Jose Luis Berasa.
Sorry for my English.
Now, I would like to request Professor Manjusha Madam for concluding remarks. Dr. Shoaib Dorji, sir, if you want to say something.
Okay. I'll be an invisible form to make comments on those sessions, like by those knowledgeable, prominent, global advocate speakers. So, of course, I have nothing to comment or add more on those three speakers. Rather than, I want to thank the AYUR Cherrycon 2025 organizers for giving me opportunity to be part of this enriching session, and congratulations to all those three speakers. Thank you.
Now I would like to request Professor Manjusha Madam, chairperson of this session, for her concluding remarks.
Thank you, Dr. Darshana. My co-chair of the session, Dr. Shoaib Dorji from Bhutan, respected Dr. B.L. Mehra Sirji and Dr. S.H. Acharya. And this is the first plenary session on this AYUR Cherrycon 2025. And means again I would say, yeah, I am too small to like comment on all the three wonderful deliberations. But still, like, I would like to say that all the three deliberations were in very much alignment with the theme of the conference, that is the GeriCon or the geriatric disorders. The very first deliberation by Dr. Gokul Murthy, who said like, I want to work, or so many things he told, and he gave very too much small liners or the acronyms. I was very much impressed by that. And he has given an overview how you can treat or how you can plan for the management of all these geriatric syndromes. And in this, definitely, he was telling many things, but I would like to add that Ayurveda has the living examples जो पुराना हमें हिस्ट्री में मिलता है, the concept of वातातपिक रसायन और कुटी प्रावेशिक रसायन, and we have the example of Chavan Rishi. Like there were the methods where the people they used to regenerate, और अभी भी हमें अपने पुरानी बुक्स में या कुछ recent journals में कुछ practitioners के, those who are not in the institutes but they are the traditional practitioners, they have treated many people in that Kuti Praveshik Rasayana, and there are incidences reported that their grey hairs have gone black, they have got the new teeth. So there is always concept of Rasayana, and there were very good practitioners in the olden time, which we have lost the track in between the, you can say the 200 or 300 years of the foreign invasion, but now again the Ayurveda is gaining its strength, and it is more so in the last 10 years Ayurveda has gone, like I can say, generating more evidences after getting the Rajeshri, after the generation or the constitution of the Ayush Ministry. I would like to thank Ayush Ministry for that. And sir ne jo kuch points, some points were told by Dr. Gokul Murthy, like he mentioned about his experience with American Geriatric Society. Then he gave a small line, not a pill for every ill. And Ayurveda always give importance to ahara first, or our rasayana first, or prevention first over the medicinal management. That goes in alignment with that. Then vaccines, of course, it's a contradictory from my point of view. Then he gave many online resources which the audience can use to see or to know about the geriatric, the status of geriatric medicine. Now coming to the second lecture by Dr. Samar Kun from Sri Lanka, who is alumnus of this institute only. He gave the overall review of Ayurveda management of age-related diseases. He gave the concept of Jara, causes of aging, overview of the age and diseases as per Ayurveda, with examples of physical as well as the psychological disorders. Then he gave the examples how you can manage this geriatric disorders through Ayurveda, that is like by Rasayana, Panchakarma, or Swasthrita Yoga, etc. And he gave the particular example like Basti Abhyang, Swet, Nasya or Murdha Tel, how it can be effective or utilized for the management of these geriatric disorders. And he shared the publications of his PhD work, and he gave some recipes or the formulations which are used in Sri Lanka for all these geriatric disorders. And of course, at the end he concluded that though there is lot of scope in this 8th branch, that is a Jara Chikitsa, but lot is yet to be done. And coming to Dr. Bera's deliberation, yeah, it is a need of hour. Seeing his presentation, I remember one presentation from Japan. I don't remember the name of the person, but they made the Shar Sutra with a plant available in Japan itself. And in Ayurveda, it is told that any plant or herb grown in that one place is more effective for the people of that particular area. So this principle if you follow, and locally, मोदी जी भी बोलते हैं ना local, speak for the local, and आज हम सब western impact में we are fond of, or fad is there for the exotic vegetables, exotic foods. So we all are also taking, like broccoli has become native for India, or the other fruits, many other fruits are also there. We want to buy those imported costly fruits. But if you see the nutritional value or impact of those drugs or even vegetables or any herb, for say, it is more local will be more effective and the cost effective also. And he has presented his whole study, studying those 10 volumes of API and seeing that in the total 19 countries of the Latin America, how many herbs are available, particularly related to Rasayana. So in that way you can see for all other major areas also. One is Rasayana, but other further than the, I think psychological or psychiatric disorders also can be the another area where we can work, because the stress and all these things are increasing in this 21st century. And NCD or the lifestyle disorders, yes, this Rasayana is the answer. So I would like to thank all the and congratulate as well all the 3 speakers for wonderful deliberation, and also I would like to thank Director ITRA, of course my senior also, my previous director Professor Tanuja Manoj Nesri, for having us here, having me particularly here, and giving me this opportunity to share my views as a chairperson in this session. Thank you very much.
Thank you so much, honorable dignitaries on the dais. Now may I request Professor Dr. B.L. Mehra sir to come over the dais and present a memento and certificate to our chair of the session, Professor Dr. Manjusha Rajagopala ma'am. So please. Thank you, sir. Mehra sir, I humbly request you to stay back on the stage. I would like to invite Professor Dr. S.H. Acharya sir to present memento and certificate to Professor Dr. B.L. Mehra sir, as we couldn't do it due to shortage of time in the Dr. P.M. Mehta oration session. Apologies for the delay, sir. Thank you so much, sir. Acharya sir, please stay back on the stage. I would like to invite Dr. Sherab Dorji sir to receive the memento and certificate from Professor Dr. S.H. Acharya sir. So please. Thank you so much, sir. I would like to invite Professor Dr. Manjusha ma'am to present a memento and certificate to Professor Dr. Darshana Pandya ma'am. Ma'am, please. Thank you, ma'am. Thank you, honorable dignitaries. We now bring this plenary session 1 to a close with sincere gratitude to our chair, co-chair, and the convener of the session. All participants are now requested to proceed for a short break. All are kindly requested to be back in 15 minutes and join us by 4:15 as we'll be commencing the second plenary session. Thank you so much.
Check. Hello. Hello. Check. Hello. Check. Hello. Check. Hello.
Good afternoon, everyone, and welcome back to AYUR 2025, an international conference on geriatric healthcare in Ayurveda, organized by the Institute of Teaching and Research in Ayurveda, Jamnagar. So we are commencing the second plenary session. I would like to humbly request our chair of the session, Professor Dr. Mahesh Vyas, Sir, Dean, All India Institute of Ayurveda, New Delhi, co-chaired by Dr. George Luis Berra, Sir, Director, Argentina. The session moderator is Professor Dr. Mandeep Goyal, Ma'am, Head Department of Chikiत्सा, ITRA, Jamnagar. May I invite all the dignitaries to kindly come over the dais. We have the first speaker of the plenary session 2, Dr. Antonio Morandi, Sir, who has joined us online. Sir, am I audible? Am I audible, sir? Namaste, sir. Sorry, sir, you're not audible. I'm sorry, sir, but you're not audible to us. So can you please make sure that you've unmuted yourself, sir?
I should be audible now.
Hello. Namaste, sir. Am I audible now?
Yes, you are audible.
Yes, sir.
What
Namaste, sir. Welcome to AYUR 2025.
Okay, well, thank you very much.
You're welcome, sir. I hereby hand over the session to Dr. Mandeep Goyal.
So, a very good evening. After lunch and a short tea break, we are back here in the second plenary session. In this session, we will be having 4 presentations. The first presentation will be from Dr. Antonio Morandi ji. It will be followed by a small video clip which we have received from WHO, which is related to the WHO policy of healthy aging. It will be followed by the presentations of the next speaker. The name of the speakers then are Dr. Saurabh Dorji sir and Dr. S.H. Acharya ji. So without taking much time, first of all, I would like to introduce our first speaker, Dr. Antonio ji. Actually, when we contacted him, he said in that short period he will not be able to reach India, but he was very happy if we gave a session somewhere in a time on 16th and 15th. So we had decided to invite him online, and we had come to know that he has a good experience related to Alzheimer's disease and Parkinson's disease. So we just offered him on the topic of management of Alzheimer's disease and Parkinson's disease and other age-related neurological issues. So Dr. Morandi is a medical doctor, specialist in neurology and certified in Ayurveda from Ayurveda Academy, Pune, India, and is also associated with the Jyoti Nath International College of Ayurveda since 2001. He has been the founder and director of Ayurvedic Point, Milan, Italy, and serves as president of the Italian Scientific Society for Ayurvedic Medicine. In 2003, he was awarded the honorary doctorate Ayurveda Acharya by the Ayurvedic Institute, Ashtavedian Thrissur, SNA Aushadhalaya, India. Dr. Merandi holds the position of Head of the Medical Education at the European Institute of Vedic Studies, Switzerland, and is a professor of Ayurveda at Master's course in Health System, Traditional and Non-Conventional Medicine at the University of Milano, Italy. He is member of the Non-Conventional Medicines Committee of the Medical Council of Milan Province, coordinating the Register of Medical Doctors Expert in Ayurveda. And he is being actively involved in the international clinical research projects in Ayurveda. Dr. Morandi is also a member of the Research Advisory Board of AVTAR, AVT Institute of Advanced Research, Coimbatore, India, and co-head of the Scientific Board of INDRA, International Network for Development of Research in Ayurveda. So with this brief introduction of Professor Morandi, I would now request Sir to kindly deliver his talk related to Alzheimer's disease and Parkinson's disease and other age-related neurological disorders. Sir, please.
Thank you very much for your nice introduction. And
sorry to interrupt you, sir. Your voice is not so clear.
The voice is not clear.
Yes.
Now, what about now? Is clear now?
The volume is low.
The volume is low. The volume is at the top, at the maximum volume.
Let us check it from our side, sir.
Yes, your side is better.
Sir, you may please start.
Yes. Now, what about the volume now? It's better?
Volume is not so audible, sir.
Oh, so can I use a sign? Professor, so thank you very much for inviting me. Thank you to the chairman, Professor Vyas, and to my very close friend, Horberra. Thank you. Nice to see you here. I'm sorry not to be able to come in person. I would like to take the time that has been given to me, to speak about one topic which is very important for me. For me, it's very important the way Ayurveda and modern medicine can interface and can, help each other to better, understand the neurological disorders and especially the disorders like Alzheimer's disease and Parkinson's disease. Now I will share the screen and yeah. Okay. Can you see it? Yes. First of all, I want to like to bring homage to all our teachers. We will be not here without their blessing and presence. So we bring homage to them. And as I was telling you, for me it's very important from the last 30 years, the attempt to interface modern medicine with Ayurveda, because I'm a modern doctor and I see a lot of the limitations of modern medicine. And I understand that Ayurveda can help a lot the development of modern medicine. And this is something that really is important for me. But we have to realize that the epistemologies of Ayurveda and modern medicine are very different, even if the nature is one. So we are looking at the same thing from different perspective. So what is important is that we have to find a new transcultural framework that needs to be identified and built in some way to identify the way in which we can get the best of the perspective, the modern medicine and the Ayurveda. So because this will be the final goal will be the benefit of the patients and the mankind. So for doing this, we have to have a cooperation between the systems, and we have to identify similarities and to have to concentrate on the similarities between the systems and not to the differences. And in this way, we have to find a way to merge, not to merge, to interface the inclusive ability of Ayurveda, the inclusive epistemology of Ayurveda, with the analytical and technological ability of modern medicine. But this is something which is very important. The advantage will be, I'm a modern doctor, so I really feel this need. The advantage will be most of the modern medicine that will be really enhanced by the suggestion that Ayurveda can give, because let's remember always that Ayurveda can explain modern medicine, but modern medicine cannot explain Ayurveda. But this is not because one is better than the other, it's because one is more inclusive than the other. It's like physics and chemistry. Ayurveda is based on physics, modern medicine is based on chemistry. So you can explain chemistry with physics, but not physics with chemistry. This does not mean that chemistry is not good, but is on another level. So modern medicine is another level, and since modern medicine is widespread in the world, the importance of Ayurveda in interfacing with modern medicine will be at the end an advantage for all the population that will benefit from this kind of interaction. And for this reason, we developed this, collaborative medicine and science. This is this framework that can help us in doing this task. The collaborative medicine and science, it has 3 steps. One is the formulation of Ayurveda epistemology in some way that can be understood from modern medicine, and not the opposite. Modern medicine doesn't have to understand Ayurveda according to the rule of modern medicine, but Ayurveda has to explain the rules of modern medicine through Ayurvedic terms. We will see this. Then we have, from this, we have the possibility of modeling of Ayurveda, and then the localization of Ayurveda, because Ayurveda it can be applied everywhere in the world, but in the world there are different conditions. Conditions in Italy, in Argentina, or in India are different. So we have to find, since Ayurveda is an epistemology that deals with the nature is the same, but expressed differently in different parts of the world. So when we want to see the methodology that the COMS use, we will find this logic. We start from modern observation, clinical, neuropathological, biochemical, and we break them, not broke, I'm sorry, there is an error, and break them into observable properties. This is the first step. The second step is that these properties are abstracted as Guruvadi Guna. And then we identify the dominant qualities expressed by these functions. For example, Ruksha, dryness, Tikshna. For example, neuroinflammation is equal to Tikshna plus Ushna plus Ruksha. So in this way, we can to map guna to function. Guna indicate dosha dynamics, dhatu status, rota's health, agni variation, oja stability. So guna are the link between form and function, perception and intervention. These help us in infer the doshi disturbance, agni dysregulation and other things, and we can rebuild the Ayurvedic model from the modern observation, and we can have a coherent interpretation of the disease from guna logic, and this can reveal hidden dynamics and progression. So this is the logic, and this is logic, give us very, very interesting insights. And we will see in the example of Alzheimer's disease, if we have time, also for Parkinson's disease. This reverse flow, in fact, leads to a new systemic interpretation and absolutely non-obvious therapeutic pathways. And this can generate novel predictive and therapeutic insights that are based on these alter guna profiles. But the logic is that from modern observation, we derived guna, and then we rebuilt an Ayurvedic model based on modern observation. In practice, COMS means that we can use traditional concepts to predict where to look from systemic connections. This is an advice for modern medicine. Then we can interpret modern findings through traditional frameworks to reveal additional layers of meaning. And we can develop research hypotheses, new research hypotheses, and these research hypothesis can be validated through modern scientific methods, but they will be validated the traditional hypothesis and the traditional insights, not the opposite. This is very important. So Ayurveda will be validated through modern scientific methods, but using the logic of Ayurveda, not the logic of modern science. The goal is not to replace modern science, as I told at the beginning, but is to enrich it with traditional wisdom while maintaining the epistemological integrity of both systems, because both systems have their own dignity, and we don't want to alter the dignity of any of them. So let's see the example of Alzheimer's disease. This is a brain, half is normal, half is Alzheimer's disease. I don't know if you have ever seen a brain from reality. A brain from reality is something very, very, very kappa. There is no other way to describe it actually in a Ayurvedic way. And in fact, the guna that we can derive from a gross observation of a normal brain are snigdha, slakshna, mridu, guru, and then we can have this image of kappa. The advanced Alzheimer's, instead, we have Rukshakara, Katina, and Laku that we give an image of Vata. So this is the very gross observation that we can have observing just the brain of an Alzheimer patient, that from a Kapha situation, it becomes a Vata situation. And from just the gross observation, what we can see is that we can derive the clinical observation, which is something that is absolutely unimaginable for modern medicine. Because, for example, all the characteristics of Alzheimer patients, memory loss, problem with language, difficulty in performing familiar tasks, decrease of poor judgment, they are all, for example, alteration of the 5 vayu, so alteration of Vata. And these reflect the loss of structural compactness and coherence. So the loss of compactness, the loss of kapha, we can see also at the clinical level. So from a morphological observation, we can derive a clinical conclusion. This is also valid for the microscopic point of view. These are healthy neurons, and the healthy neurons, they have some features that from a Guruvadi Guna point of view can be defined as Laku, Ruksha, and Kara, so Vata, or Tikshna, Sukshma, and Vishada, and Pitta. And in fact, we know that the neurons have this Vata morphology and Vata distribution, but with an incredible possibility of Agni, of fire, of Pitta firing. And so an healthy neuron is a good combination between Pitta and Vata. This is an Alzheimer brain from a neuropathological point of view. You can see that all the structure is disrupted by neurofibrillary tangle and Alzheimer and amyloid plaques. The amyloid plaques are really, a bunch of ama. They are pichila. They are pichila from also from a description point of view. And in fact, we see that in an Alzheimer brain, from a neuropathological point of view, we find an increasing Laku, Ruksha, and Kara. So they become more Vata, but they decrease Sukshma, Tikshna, and Vishada, because these guna are altered by the presence of the amyloid plaques and the neurofibrillary tangles, giving rise to Pichila, Manda, and Stula, which are, the signs that we can find also from a clinical and also a physiopathological point of view of the alteration of the flow of thinking and the flow of action of an Alzheimer's patient. And this happens also at the level of the ultramicroscopy, where we have, the tangle formation, which are, collapsing, and where the pichila feature is very much evident. But what happens in an Alzheimer brain from a neuropathological, from a biochemical point of view? The problem is that there is a decrease, is an exposure of the cleavage side of amyloid protein. Amyloid protein is a transmembrane protein, which is normally cleaved. There's a contact protein between neurons. And when we have, if we have an alteration of the lipid membrane, a decrease in thickness of membrane, lipid membrane, this protein is cleaved to a place which is transmembrane and so is hydrophobic. And when this fragment of 44 amino acid is left free in the environment, it tends, since it is hydrophobic, tends to stick together and form the amyloid plaques, which disrupt all the network of neurites and all the network of neuron communication. This is something which is evident from an Ayurvedic point of view. If when I was a scientist many years ago, 40 years ago, I was studying Alzheimer's disease, I would have loved to have the Ayurveda education, because at that time I would understand immediately what was the problem, where was the problem. Because the Vata problem means that there is a decrease of Snigdha, and if there is a decrease of Snigdha, there is a decrease in the membrane. And this is decrease in the membrane only in the most recent time has been found. So the pathophysiological sequence, according to Combs' logic, it comes from an alteration of Meda Agni, and this Meda becomes dry, light, poor quality, and from this there is a loss in Snigdha, the diffusion of Vata, the cognitive disconnection with a guna mismatch, Sukshma plus Tikshna without Snigdha, and so there is later there is also the kapha ama formation, like these amyloid plaques. So Meda loss from the other side is not even local. In fact, Alzheimer's disease is not a local disease in the brain, but is a general disease. All the membranes of the body are affected. But this Ayurveda knew, because it's very simple for Ayurveda to understand what is going on through the guna analysis. Modern science that keeps the things all separate only recently arrived to the fact that all the membrane in an Alzheimer patients are altered. Not only the neurons, but the fibroblasts, the platelet, and so on and so forth. So the disease begins not in the neuron, but in qualitative failure of insulation and meaning integration. And this is give us the image from a morphological point of view, and also from clinical point of view. These are some of the recent papers that put in evidence the fact that there is a decrease in thickness of the membranes of the neurons in Alzheimer's brain, and also in other part of the body. So what are the novel therapeutic insights that we can derive from this, that Ayurveda can suggest to modern medicine? First, address Meda Agni before amyloid formation. Then, to prevent ruksha when early sneha rasa plus Agni dipana, with early sneha rasa plus Agni dipana, Agni dipana and amapachana. Use guna balancing therapies to prevent the terrain from neurodegeneration. So these are very important things which are absolutely misunderstood from modern medicine. So the goal is not just to boost memory, because what modern medicine does is just to boost memory, but to restore the terrain of connectivity and coherence. From this, we can see that from this point of view, from the therapeutic point of view, these are the logic of the therapeutic that we use in Ayurveda, with Sneha, Medhyarasayana, Vatabasti, Nasya, all with the function to rebuild the terrain. But what happens if we have an Alzheimer patient that is using modern medicine? Because this therapeutic insight, they can give us also some hint also how to use better modern medicine. Because if you look at modern medicine used in Alzheimer's disease, like acetylcholinesterase inhibitors, like donazepam or rivastigmine, we see that from the guna point of view, these are medicine which increase sukshma and tikshna, but lacks snigdha and stira. So they improve the information flow, but they do not give the possibility of integration and anchoring. So they act like a media stimulant, but without oja support. And this may worsen the chala and ruksha if there is not the proper sneha and OJAS care. So what we can do, we can couple the acetylcholinesterase inhibitor with Rasayana or SNEHA support like Grita, Brahmi, to prevent the vata aggravation due to the acetylcholinesterase inhibitor. So we can get the best from acetylcholinesterase inhibitor, giving the support also of Ayurveda to let that drug work in the best way. Or, for example, the NMDA receptor antagonist that are the one that try to block the excess of glutamate toxicity in Alzheimer's disease, because sometimes there is this glutamate toxicity that is one of the signs of neuronal death. This dampens Tikshna and Chala guna, but they create Mandashita with the risk of further cognitive dullness. These are Manda-inducing agent because they are Pitta-Vata pacifying drug, but there is a risk of OJA suppression. So we have to pair these drugs with Agni-Dipana herbs, like Vacha, Pipali, and to maintain alertness and protection. I don't know if I have time to speak about Parkinson's disease or not, because the mail told me that I have only 15 minutes and the 15 minutes are over. So if you tell me that I can go on, I go on, otherwise I can stop here.
Sir, you can continue with the Parkinson's part.
Okay.
Yes.
Thank you. So let's see the example of Parkinson's disease. The example of Parkinson's disease is a loss of the dopaminergic neurons in the substantia nigra. Now you can see here, for example, this is a spectre of image of this the unhealthy brain on the left and the Parkinson brain on the right. The red, parts are the dopaminergic neurons, which are decreased in the Parkinson brain. And this is a neuropathological image. And you can see in a healthy patient, a Parkinson's disease patients. In the Parkinson's disease patients, you see that there is a loss from a gross anatomy point of view of substantia nigra. And from a microscopic point of view, you can see also that there is a neuronal alteration with the presence of Lewy body. Lewy body are these bodies that are formed inside the neuron that compromise the function of the neurons and which have, very clearly guna feature from we can see that they have this pichila, this manda, this very dull appearance from a descriptive point of view. So what we have from a biomedical feature, we have that that Parkinson affects substantia nigra, that means deep brain tissue, that means from a guna interpretation, Majjavaha's rotas under Vata Meta control. Then we have Lewy bodies, they are protein aggregation with the guna of Pichila Guru, and that are meaning of Ama and Kappa, increase. Then we have a neuronal loss in substantia nigra with the presence, with the shrinking of the neurons of Ruksha, Shita, and Kara. Mitochondrial dysfunction in those neurons that we have a Tikshna plus Shita, but because there is an Agni-Vata mismatch, so when there is this increase of Tikshna, because there is an increase of Tejas, and there is a loss of Jala, so for this reason, there is the death of these neurons, the alteration of these neurons. But in Parkinson's disease, we have also early gut involvement. Again, also this is a systemic disease, it's not just a disease of the brain. And this is a sign of kappa ama blocking rasa apana. And all the disease actually has a terrain that is dense, sticky, cold, and obstructed. And these are classical signs of ama and kappa blocking vata in deep rotas. So the problem of the Parkinson disease is not a pure vata problem, but is a problem of vata blocked. So it's a problem of vata blocked by ama. And we can map, like we have done for the Alzheimer's disease, the clinical situation also from with guna. We have tremor, rigidity, bradykinesia, constipation, depression, which can be all referred to guna alteration and dosha and strota alteration. So from a whole view, we can say that the functional breakdown of Parkinson's disease emerged from the interplay of Vata, Kapha, and Ama, with Vata becoming unstable and ineffective due to Srotoroda. And this is something that, from an Ayurvedic point of view, we know. But this is something which can be very important also for understanding better the Parkinson's disease from a modern medicine point of view. So, from the pathophysiological point of view, from the Ayurvedic side, Parkinson has the primus movens in Ama-Kapha accumulation in Rasa and Majas rotas. This obstructs Vata Vata, especially in the basal ganglia, where movement and habits are coordinated, and this we will see because this is very important also from a symbolic point of view. Vata cannot circulate, causing tremor and bradykinesia. Meda and Maja Dhatu begin to degenerate because there is this Vata dysfunction, and they degenerate later than in Alzheimer's disease, causing fatigue, apathy, and emotional instability. So you see, the story of Parkinson's disease is different from Alzheimer's disease. Alzheimer's disease, there is initially Vata problem with all the membrane alteration. Here there is a Kapha Ama problem with secondary Vata alteration and secondary alteration of the morphology of Vata. The result is loss of integration between intent and action, memory and movement. This is because the problem is at the basal ganglia, which is the deep part of the brain. In fact, we can have also a symbolic interpretation. Basal ganglia govern habitual motions, non-conscious initiative, and motor learning. In Ayurveda, this reflected the karmashaya, the store of latent tendencies. Rigidity and bradykinesia reflect a block in sankalpa, which means the deep intention, the start of an action. So Parkinson's disease represents a disconnect between the inner will and the outer gesture, rooted in blocked Vyana, Manas, Maja pathway. And we can see, and I will not speak about it here, how this is important in the psychological traits of a Parkinson patient. The psychological traits of a Parkinson patient are always related to an inner deep problem of having this the connection between the will and the action. These tips, the anatomical location mirrors the depth of the energetic disconnections. So the depth of Parkinson's disease anatomical target, the basal ganglia, is not incidental at all. It reflects a disruption of the deepest circuit of will, habit, and identity. And since body and mind are the same for Ayurveda, and the problem, an alteration in the state of mind, is the alteration which is at the base of the physical and then functional alteration in Parkinson's disease. So what are the novel therapeutic insights that we can derive from this? Parkinson's disease symptoms emerge after measured neuronal loss, but guna shift, ruksha, kara, chala, can manifest years earlier. Modern medicine sees alpha-synuclein as toxic, but COMS sees Ama-Kapha as a consequence of Srotoroda. So alpha-synuclein, which is something that modern medicine find present there, is a consequence. It's not a cause. Neural loss is Majadatukshaya, often arising from meta-depletion also at this level, and fault meta-agni. This also later in the disease. Tremor, rigidity, and bradykinesia are not pure Vata sign, as I was telling before, but they reflect Vata being unable to circulate due to Kapha-Ama blockade. Modern neurology separates motor and psychiatric symptoms. COMS sees them as manifestation of the same terrain collapse. So again here, the goal is not just to boost memory, but to restore the terrain of connectivity and coherence. And these are the tools that we have in Ayurveda for doing this. And Ayurveda is very good in helping Parkinson's disease patients. Tictas Nehabasti, Lechanabasti, Mediarazayana, Majja Mediarazayana, and so on, with all, a perfect logic in guna targeting and in the function targeting. But let's see how these help also modern medicine, these novel insights, because these are the drugs which are used. Is widely used dopamine agonist. Dopamine agonists are very widely used. They replace dopamine, which is the loss because of the loss of dopaminergic neurons. So they strong stimulate Tikshna, Chala, and Laku. But there is a big risk because they destabilize Vijnana Vata. They may increase. In fact, there are a lot of problems in the dosage, in the stop and go, in the many other in many there are a lot of problems in the function of a dopaminergic agonist because they may increase the tremor or mental agitation, and these are collateral effect of normal the modern drugs based on dopamine agonists, because they activate motions but they deplete more and more meda ojas because they are very ruksha. So they need sneha plus stira for counterbalancing this. So we can use them in short cycles with vata pasipine therapies. And this will give us the possibility to use at the best the dopamine agonist with a lot of advantage for the patient. Then we have, the very invasive technique of deep brain stimulation, which is a true injection of Agni, is an Agni karma applied to Majjavahas rotas. And this, can be really a firing solution. But there is a big problem because these are hugely tikshna. And then they can give problems. So we have to prepare the terrain again here with Basti or Rasayana to make the deep brain stimulation more integrative and to reduce the tikshna, the excessive tikshna side effect. And then we can have, some kind of post deep brain stimulation therapy to stabilize chala and to support stira and rebuild ojas. Because all these therapies, they destabilize, vata deeply. And we have to give, some kappa sustaining situation without increasing kappa, which is the big problem in Parkinson's disease. So, at the end of the story, what I'm trying to say is that we need one framework for one medicine. We cannot go on with having, different framework for different medicine. We have to find a way to run together, to go together, to go aligned with the same dignity, of course, with the respect of the epistemology, with the respect of the history of each medicine, but for the benefit of the humanity, for the benefit of the mankind, for the benefit of the patients, we have to find a way to find, a common path and a common view. And we think that COMS can help for finding a novel common framework for research and education. Thank you very much.
Thank you so much, sir. The gist of the whole 30 minutes presentation, what doctor was trying to convey was that understanding of pathogenesis of a disease is very important. Either we look from an Ayurveda point of view or modern point of view. And in this half an hour, he was trying to make us understand that when we are talking about the Vata Vyadhi, there can be a presentation when there will be Dhatu Shaya, or there will be Avaran condition, or there will be Nirupastham Avastha, or it may be Avastha where Vat will be an Anubandha of other conditions. So, understanding the disease in this way, not treating a patient with only one diagnosis and one treatment, the deeper information of the pathogenesis of the disease, whether it is from Ayurveda point of view or modern point of view, is very important. And so if we are treating a case of Parkinson, making a modern diagnosis and Ayurvedic treatment, still understanding of selection of best drug in that particular pathogenesis of your patient is very important. So I thank so much, sir, to bringing in light to our young scientists, understanding about the diseases, whether it is from modern point of view or Ayurveda point of view. Ultimately, the goal is that the patient should be getting the best or he should be healed. And so no pathy says that I am best or that is worst. All pathies shall come together in a form of integration or in a form of complementing each other. So with this, I thank you again, sir, for accepting our invitation, being online and sharing all your experiences with us. So with the permission of chair and co-chair, we may move to the next deliberation. If there are any questions or any queries from our participants, we will share with you, sir. And if possible, at the end of the session, we may discuss on it. Thank you again, sir.
One thing, if
so we move forward.
Because since I have some patients now, I think that if there are some questions, they can write me an email. It will be the best. It will be my pleasure to answer.
Sure,
but,
sir.
I have to leave now. Yeah,
sure.
I'm sorry.
Thank you so much, sir. We will share the questions if they are. Thank you, sir. So moving forward, there is one more addition to this plenary session. Actually, when we visited WHO GTMC Center with the experts of WHO, I was informed that WHO has already prepared a framework for healthy aging, and they were very eager to share that policy and the experts who have been involved in that WHO framework and policy for the healthy aging. So before we move for the next presentation, we will just have a presentation of WHO. We just go through it, and then I will invite the next speaker.
Be done differently? What are the innovations or new practices that are evidence-based in order to implement a life course approach, given the current organization of health programs, health services, and across sectors within a country and, the situation of the country? It's important for us to note that when we describe a life course approach, we say that it includes a good start to life, optimal development of infants, children, adolescents, and youth, adult health and well-being, and healthy aging, as well as a dignified death at any age. And our focus is really how to put in practice a life course approach, not only the types of models or theories behind it. That being noted, it's really important that we identify interventions to optimize health and well-being and document a person's health trajectories across the life course. And that's really part of an anchor in when we say how to implement it. So this slide shows the level of health and well-being along the vertical axis and life stages across the horizontal axis. These aren't just age groups, but critical and sensitive periods that offer strategic development and reserve building opportunities. What connects a person over time is physical and mental health, not simply the absence of disease. And importantly, their opportunity and ability to experience well-being. Certainly, genetic inheritance is important, but environment matters between 50 to 70%. A life course approach is informed by what happens in each life stage and how that has relevance for the next and future life stages, as well as for the next generation. So early risks to health and well-being, for example, in adolescence, are associated with 70% of preventable deaths from NCDs in adulthood, including 50% of mental health illnesses that are established by age 14 and 75% established by age 24. These explain 14% of differences in physical and mental capacities among older people. So early action is impactful even in later life stages. For example, physical activity after the age of 20 is associated with better life cognition, particularly episodic memory and verbal fluency, as well as prevention of locomotion limitations. There's a lot more evidence on ways risks and exposures and strengths accumulate across the life course and impact health and well-being. The new report collects evidence on impactful interventions, such as baby-friendly hospitals that can mitigate low birth weight or comprehensive assessments of older people to detect as early as possible potential declines in physical or mental capacities, and many others that are highlighted in the report. But as I said, the question is, what can be done with this knowledge and other knowledge so that these disparate evidence-based interventions and innovations can be invested in, implemented, and reach all people who could benefit, whether through universal programs, targeted interventions, or those developed with other sectors that reach people where they work, learn, play, and live. And of course, how can we learn from each other and fill in the evidence gaps so that we can link optimal development, build reserve capacities, and maintain health. And, even when there are declines in health, we can still experience well-being. So this is highly relevant as populations are aging and the length of life over 60 years is expanding in every country. These are precious years where we can redefine what it means to be human and humane. Part of the life course approach is that we want to increase health span, not only lifespan. And this is key to longevity that doesn't simply tack on those extra years at the end of life. So, for example, in the report, we have 5 sections, and in section 1, we say that we really accent that we have to reorient services towards person-centered holistic care models. So this is highly relevant and intersects with traditional medicine approaches. So what do I mean? It's not the absence of disease. It's good life. It's well-being. And it's really about having a potential of impact on physical, mental, and social health. So the framework uses this person-centered approach aimed at preventive, holistic care and planning and continuity of care. For example, this includes multimodal exercise for older people with declining locomotive capacities, and includes strength and resistance training and other exercises to improve balance, flexibility, and aerobic training. So when we talk about health capacities, we're talking about cognition, physical movement, psychological capacity, sensory, hearing, vision, thriving, which is really important for children, and vitality, which is very important for adults and older people. They're very similar in what is being considered. Also, sexual and reproductive capacity from adolescence. There are other areas, and these are the most important ones that were drawn from the WHO International Classification of Functioning Disability and Health. When we talk about well-being, we want people to have the abilities to experience well-being, including agency and resilience, basic needs, food security, housing, healthcare, ability to contribute to families and communities and broader society through a range of paid and unpaid work, volunteering, cultural, and conservation activities, learning and increasing capacities, the ability to be mobile and go where you want to go, maintaining relationships and connectedness, and there are others also that are identified in diverse strategies. So in section 2, we describe in a bit more detail the models and background and the importance of identifying critical periods and transitions to prioritized targeted interventions. And I really am wanting to learn and encourage you to consider what are those interventions in traditional medicine that could be really useful. For example, we have a heuristic, a framework for action. Life course includes social determinants where factors are amenable to policy and actionable with impact. We want to optimize those health trajectories that I showed in the earlier slide. And, we had a recent discussion between member states and the Secretariat, the WHO Secretariat, and we clarified that to foster healthy aging and longevity across the life course, we want to continue to build up evidence on interventions that directly address the needs of current older people. Very important given the research and innovation mandate within the UN Decade of Healthy Aging, where we are currently at the midpoint, and we have to ensure the right to health of older people. But we also want to learn from interventions and programs, such as in traditional medicine, what can be done from earlier age groups through older age that can be applied to older cohorts. Which is reflected in both the health system and multi-sectorial work. For example, WHO's integrated care for older persons approach was inspired by the integrated management of childhood illnesses in the sense of packaging as a program. Finally, we really want to clarify evidence from all regions on what interventions in earlier age groups yield benefits for adults and older adults, because our aim is to provide proof of concept that such evidence can be assembled and actually be used. We've done something similar looking at adolescent health outcomes that have impacts for older adults and adults. And we focused on cognitive capacities as well. So we have in section 3, note that we really should apply the 6 life course principles in health system design and policy development. These include focusing on the whole person, as I mentioned earlier, but also having early evidence-based action, putting these in place so they are impactful given the local context, ensure that they are taken together with other sectors and people of all ages. Overall, we want to promote health equity so that we can bump up those positive health trajectories as early as possible. And finally, we want to ensure actions connect all life stages and critical sensitive periods. So a life course approach is not only looking at, let's say, newborns and children, or only looking at adults and older persons, but really looking at everyone. So I really hope that this framework can support the types of research that you are doing. We think it can be used to support implementation of existing strategies, calling on a life course approach, support identifying evidence-based services for each life stage, contribute to strengthening all objectives of universal health coverage, as well as help shape investments and other support within the health sector and beyond to optimize those health trajectories. I also hope that this approach can inform your research as well as discussions at the second WHO Traditional Medicine Global Summit that will address restoring balance for people and planet, the science and practice of well-being. I look forward to collaborating across WHO, including with Traditional Medicine Research Data and Innovation Unit, and invite interested researchers to join our virtual Life Course Network meeting on 5-6 November next month. So with that being noted, thank you very much, and I wish you a very successful celebration.
I think so it is a video message recording. She may not be able to listen or hear to us, but it is something to me it appeared like it was a complicated form of our Rasayan and Vajikaran, because whatever concepts were discussed in their strategies, what they are planning for the healthy aging, the new word they have adopted is life course approach. And life course approach is just based on the preventive, promotive and predictive health care, what is needed in the society now in the world. So Rasayan and Vajikaran, the beginning chapters of the Chikitsa Sthan of Charak Samhita, are the answer for what they are searching for. And so only they are looking towards the traditional medicine to give some solutions for healthy aging, and also not only the aging, medicines at the proper time, so every phase of the life is having a health. So with this, as the time is running out and we are always short of time, we move towards the next presentation with the permission of chair and co-chair of this session. I would like to invite Dr. Sherab Dorji, representative from Bhutan. I'm very happy to share that being a part of WHOCC, that is collaborative activity, we had been a close touch with the Bhutan for the traditional medicine as a part of CERO activity, as training to the clinical research methodology for the CERO states. And we had arranged many online training sessions for the experts of traditional medicine in Bhutan. And I'm very happy they are also our MOU partners, and they are continuing their collaboration with ITRA. So with these words, I would like to just introduce our next speaker, Dr. Sherab Dorji. He will be speaking on the topic of role of Bhutan's traditional medicine system for aging population in Bhutan. Dr. Dorji is a distinguished scholar, educator, and artist from the Kingdom of Bhutan. He serves as a senior lecturer and deputy dean of the academic affairs at the Faculty of Traditional Medicine, Khesar Gyalpo University of Medical Sciences of Bhutan. He holds a bachelor's in traditional medicine from Royal University of Bhutan and master's in integrative medicine from Chulalongkorn International College of Medicine from Thailand. With deep dedication to teaching and research, he has authored several publications like in the Bhutan Soaring Journal, contributing significantly to the academic growth of the Bhutanese traditional medicine. So with this small and brief introduction, I would now request Dr. Dorji to kindly proceed for his deliberation on role of Bhutan's traditional medicine system for aging in Bhutan population.
Good evening. Thank you for the opportunity once again. Actually, I'm not a graduate of Ayurveda, but due to some privileges bestowed upon me, I got some chance to see what is Ayurveda and what things are done with Ayurveda. So, in brief, I can tell that the traditional medicine system of Bhutan, which is Sowa Rigpa, and Ayurveda shares the similar philosophy, similar concept. So, actually today I don't have any special or original research evidence to be presented here, but still then, as I am given chance to present, I just gone through some articles and data and review a little bit that what can traditional medicine of Bhutan can do for the aging population of its own country. So, yes? Oh, okay, okay. Bhutan's population is shifting towards the older than 60 years, and for right now it is around 6.6% of the population is aged over 60, and by 2040 it is going to be around 14 to 15% of the population is going to be more than 60. So, which is like 1 person in 7 will be aged 60 or more. So, this reflects the improved health quality and longevity, which is the death rate, the age of death, that it has enhanced the longevity and improved the quality of health. But however, with aging it brings like challenges such as chronic illness, which is more with the non-communicable diseases and social isolations. So, therefore, the aging is now a policy priority, because the Bhutan is focusing on the developmental philosophy of gross national happiness. The aim of the review is to explore the role of traditional medicine, which is Sowa Rigpa, in elderly care, and to emphasize how traditional medicine supports healthy and dignified aging. A simple method that is used to develop this article is a descriptive literature review using some national and international sources. The sources are health reports, UNFPA data, peer-reviewed studies, some journal articles, and the classical Sowa Rigpa text. And the focus is to see the health trends in Bhutan and social challenges that are faced by the elderly people in Bhutan, and the role of Sowa Rigpa that can play for the aging population. So, aging and the health challenges are firstly the NCDs, that around 63% of the cause of death in Bhutan is due to NCDs like hypertension, diabetes, and cardiovascular diseases, cancers, and etc. And also there is some functional, due to aging, the problem is the functional decline and reduced mobility are also one common thing. But unfortunately, the geriatric care services are limited in Bhutan as per the reports. And also the family support system are weakening due to modernization or materialization. Actually, the culture, in the culture of Bhutan, that there used to be a strong bond in the family, but due to modernization and due to materialization, I think the younger ones are migrating with their job or their work or their business. So the elderly people are left alone. So that is the problem with the rural urban migration. So the traditional medicine in Bhutan, it has been started with the unifier of Bhutan. He is a leader of religion, that the Shabdrung Ngawan Namgyal we call, and it was in 1616. So first the organized system of traditional medicine began under his reign, and it was in the monastic institutions who served as center for the spiritual and medical care. And healing practices were based on Tibetan medical texts, so especially the Juji. And by 1967, we regard His Majesty the late Third King as the father of modern Bhutan. So His Majesty instituted that traditional medicine under the state patronage, and established the National Indigenous Medicine Hospital, and also has marked the beginning of integration of traditional medicine and modern medicine. And by 1971, the traditional medicine formally integrated with the Ministry of Health, that all the hospitals all over the country were integrated with the traditional medicine unit and with the modern medicine hospitals. The actual training of traditional medicine practitioners started in 1978 with the establishment of National Institute of Traditional Medicine, and this is to train, we call the physicians Drungso and the assistants as Mempas, and also initiated the local production of herbal preparations and strengthened education, research, and service delivery in traditional medicine. And now the National Institute of Traditional Medicine evolved into the Faculty of Traditional Medicine, as I mentioned earlier, that under the Kesargeva University of Medical Sciences by 2014. And now the faculty offers bachelor's program, diploma program, and other research and postgraduate programs also. And it is focused on preserving the Bhutan's Sawarikpa heritage while integrating with the modern medicine. So, how the Sawarikpa traditional medicine of Bhutan sees the stages of life is it is similar to Ayurveda, that we consider the childhood as the stage of phlegm, which is of kapha stage, and the adulthood as the bile stage, pitta stage, and the old age as the vata stage, wind domination. So in the old age, the wind humor becomes dominant during old age, and this leads to the dryness, stiffness, reduced mobility, tremors, and other degenerative changes. So the definition of aging, we call it as Geba. This is botanist term, refers to the gradual decline in physical strength, sensory perception, memory, and vitality that occurs with advancing of age. It is also viewed as the process of deterioration of body tissues, and the dung is also a botanist term, that the essence of body declines, which is a loss of vitality and immunity. However, the services available through the traditional medicine are diet and lifestyle management, which is through consultation, and herbal preparations, moxibustion, cauterization, venesection, herbal compression, and oil massage, effusion, steam therapy, and other 5 detoxifying therapies. And as per the patient report, it is seen that more than half of the patients that has visited traditional medicine hospital are above 60 years of age. And the diseases or health problems that are treated in the traditional medicine hospital are gout and arthritis, hypertension, diabetes, sinusitis, migraine headaches, anxiety and some mental problems, musculoskeletal problems, and digestive and respiratory issues, and some other skin disorders. So therefore, by looking at this, we can align that the traditional medicine system can play for the aging population. And one of the issues is also a psychological and social care. And the traditional medicine wellness department can promote mental calmness and emotional stability through yoga or meditation or some wellness therapies. And it includes like spiritual counseling and community-based healing, strengthen cultural identity and belonging among elders. So therefore, there is need of system integration. Of course, it is very evident in the policy level. I think still there is need of some practicality. Like traditional medicine units are co-located with the hospitals and BHUs all over the country. And there is free and dual access to traditional medicine, dual access like traditional and modern medicine, healthcare for all the population. And also the traditional medicine supports gross national happiness principles and holistic well-being. So as a discussion that the aging challenges are medical, psychological, and social. And from the perspective of traditional medicine, that offers culturally resonant and holistic care. And only the thing for the practical is for integration with the modern medicine health services which can enhance the healthy aging. So as a conclusion, Sowa Rigpa, the traditional medicine, is a vital pillar in elderly care that is accepted by everyone, and the integration strengthens quality of life and dignity among older adults, and that can be support holistic aging within Bhutan's gross national framework. Thank you.
Thank you, Dr. Sherab Dorji. The presentation actually was based on his experiences of aged population in Bhutan and its management with the traditional medicine of Bhutan, that is Sowa Rigpa. But the short things which is coming out of it, aging is now become a universal problem. It is similar in all over the countries in the world. Issues remains the same, and traditional medicines which are practiced in different parts of the world, the principles remains the same. Maybe the terms are a little bit different. Understanding is the same, and the treatment also is nearly the drugs which are commonly or easily available in those area or in those countries. So I thank you so much, sir, for your sharing your information related to the aged population and its problems and its management from the traditional medicine in Bhutan. Before we move to the next presentation, I would like to felicitate the speaker, Dr. Sherab Dorji, sir. Kindly please come on the dais. I would request our chairs and co-chairs to kindly felicitate. And meanwhile, if somebody has something to ask or have any queries, can also raise. Thank you, sir. So, yes, sir.
I have no question with this presentation, but just for the information of the audience, I want to tell that Indian system of medicine also includes this sovaripapathy, and we have 7 sovaripa colleges in India itself with the 15 intake capacity. So total 105 sovarippa candidates are admitted every year, and this pathy is recognized by Ministry of Finance, Government of India. This much information I want to give.
Thank you, sir. Now we move forward. I would now invite Professor Dr. S.H. Acharya, sir, who has been actually associated with this institute for nearly 26 years. If I am not wrong to say, maybe late 80s till late 2010. Sir was associated in this institute in a capacity of Professor Panchkram, and then later on he took the retirement. It is like he just take the voluntary retirement, and because I was associated with him because I worked under him as a lecturer for the foreigners or the international course where I am dean today. So he was too much associated with the education and associated with the international scholars, and he continues his journey, and he is now known as the international ambassador of Ayurveda. He has nearly traveled more than 20 countries, and whenever he is in Jamnagar or is about to be in Jamnagar, he always has a query. If you have some students, I can share some information. And I know his Charak Adhyan classes online and offline are also very popular. So, and from the last one day, he is being with us for the pre-conference workshop. He has contributed his experiences with us for the syllabus framework, for the skill, and now I invite him as a keynote speaker of the plenary session. Kindly, sir.
Good evening and thank you. I know everybody needs rasayana, particularly in the end of the day when your exhausted energy is out. I do not know how much rasayana I have to dispense now. I will do my duty here. I know I am very much aware of the timings which is running out also. I would like to share a little bit of things regarding what exactly, where we stand. So-called we call to manage in geriatrics with Ayurveda. Honorable chair and co-chair persons and the convener of the sessions. In the outset, I really thank the institutes to remember me, to invite me, to get involved with this very momentous program which is happening, and also the Silver Jubilee. I congratulate. Yes, I was immediately after Dr. Baghel, I took over as the director of the International Center till 2011 that I returned. What we talk about geriatrics, actually it cannot be a synonym with Jara Chikitsa of Ayurveda. Jara Chikitsa is much more than the geriatrics of the modern conventional medicine. It's a very much more holistic concept that I will try to touch a little bit, but in the outset I will tell that it is not just treating the diseases of the elder population. It is something more beyond. Since in the morning, we have been already discussing a lot of things about it. Let me highlight a little bit of these things. Yes, we have already discussed that the aging is inevitable. We know that it's Swabhava Vyadhi as it is, and it is inevitable. So that Swabhava Vyadhi is Nishpratyanikaha. It does not have any treatment to be done. This is first to be accepted that we have already seen. But however, the nature always has this, the two concurrent things goes on in the biological sphere. And we are very much aware that Swabhava, and we have two things, Samanya and Vishesha. They have to work together. The plus and the minus, the positive and the negative have to be there if the living organism has to live. Only thing is, when the things of the negativity is a little bit more, then there is illness, and then there is the sign of aging. This is very much important that we must learn. How to live positively throughout the life, this is best anti-aging. When the positivity, not just the physical, but also mental, I always say this is very much important, even for the group of people who are mature or already in the senior age. I always tell, and even yesterday I spoke, the concept retirement is wrong. First, once that enters into your mind, that first shows the sign of aging. So never accept that concept of retirement, then you will be young, always young. That is a promise that here. So let me talk about this. I always quote this pharmacologist, Hans Selye, who is considered as father of stressology in the modern medicine. He has written a big book on general adaptation syndrome. And he says every illness can be defined on the basis how an organism fights stress. The stress in the sense, he does not speak of any infection, no virus, bacteria, organism entering. He also talks about stress and how the body adapts. The thing is, within the whole concept, what he says that he defines stress. Every stress leaves an indelible scar in the system, and the organism pays for its survival because it has to fight the stress, but it fights and wins, but it has to pay. What is the payment? By becoming little bit older. This is how the aging is defined, that you win it, but actually you do not know you have already started aging. This is very much important from that. I actually appreciate this is where our rasayana is coming into play in this juncture of the systems fighting against the stress. Whether it is a visible stress or even an unknown stress, like even living in the urban society is also stress. We hear about urban stress. We do not feel it, but just living in a city is a stress. And we think that is a laudable account that somebody has done. And there's a book I always quote, The Human Zoo. It was awarded, and I used to read that. He's a curator of the zoo in Britain. He found that human beings in the cities, they construct zoo for themselves and they live in the zoo. Why he told? Because the animals which are in the zoo, they get diabetes, they get hypertension. Even the elephant in the temple, they get diabetes. And they have been given to Vantara here. There was a case in the court already. So the domestic animals get diseased, but in the wild, they are not diseased. This is very much important. The Human Zoo, the whole book was written, and how an urban stress is affecting. But this is not a new concept. The first notation of this urban living stress is in Charaka Samhita. The whole concept of Rasayana came, there is a story of how the Munis, Rishis came down from the Himalayas, and they have been requested by those settlements of human beings to stay with them. They started accepting food and water. They start the sign of aging. This is the first ever, and they have immediately they have sensed this is because of the Gramya Jala Sevanam. Gramya Ahara Sevanam. This is the first ever indication of urban stress and aging that we have that. However, the scientists like he definitely put this and general adaptation syndrome, and what can help it? He says there is an inbuilt strength in every cell and tissue and system that helps to fight. Unfortunately, he was not aware probably of the concept of bal in Ayurveda, which is the most important to fight against stress. That is the adaptive gen, that is the immunity in the body, and this is where we always speak about Rasayana. Now, talking about the aspects of aging, it is not general. You cannot consider it in a general manner. There are different phases in the aging itself as per the Ayurvedic concept. So accordingly, the prescriptions that you make in the management of aging is also has to be different. You cannot use Rasayana Dravyas at random. I don't think you will get any beautiful results out of it unless until you know how to use it. Herb is not Rasayana. The way, in the manner in which you administer, that is Rasayana. Labha upayohi, when it says labha and upaya, Charak Samhita, that is defined as Rasayana, not the Dravya as Rasayana. If Guduchi, the Tinospora cardifolia, you know, it's very good. In hepatitis, it works very good. Guduchi is good in Jwara. Guduchi, yes, in anemia, Pandu, it's very good. And Guduchi, yes, Vayasthapak Rasayana. Do you think you eat at random Guduchi and expect Vayasthapana happen? No, it cannot happen like this. We need to understand it precisely what we are targeting and what are the medicines which are used in a wise manner. The chronological aging that we have, there are two we have to understand things that in the morning aspect. When you say Jiveta Shardam Shatam, yes, that's chronological aging, 100 years. This is the life expectancy. But not just that there is a biological aging, that when he says the quality of life is very much important. In Charaka Chikitsa Sthana 28th chapter, praising about Vayu, Charaka has put it, he says, Vayu syat so adhikam jivet. Even you cross the 100 years, Vita roga samahasyatam. The word Vita roga is important. He was not sick. He lived beyond. Even at the age of 100, he was not diabetic, he was not hypertensive. This is the biological quality of aging, and we should know what we have to do. I always tell, probably even today to this century, we do not have any textbook of medical, conventional medical specialty or another modern medical textbook. On the first page that it talks about extension of life. The Charaka Samhita, as you know, the Sutra Sthan, Prathama Adhyaya, Athato Dirgham Jivityam Adhyas, you know, first Abhyasyamaha Itihasmaha Bhagavan Atreya. The first chapter of your so-called medical book in Ayurveda speaks about extension of life, not of cancer, sir, not of intensive care, not of tuberculosis, but on life extension. This is where Ayurveda has the prime role in the topic of geriatrics, how to live the wisdom of Ayurveda. In the first chapter, it is not Amalaka Rasayana, it is not Chavanaprasha in the first chapter. What is there in the first chapter? The word Ayurveda. Knowledge of Ayurveda, knowing of Ayurveda, you have learnt Ayurveda, you have already added a day or two to your life. This is how it works, aging. It is not just with the drugs that we take. How we promote the person on anti-aging, this is very much important, not just the absence of illness. That is what we have to see. So what exactly we want to talk about this, how we can categorize for a Vaidya practitioner. What are the wider areas that we may consider when you want to treat the aged populations? When we see that there are a lot of things to consider, the aging, what I want to say is, it is not individual. Aging has to do something with the society also. It is not Vriddha that is individual, it is reflecting the society. So when you make an anti-aging treatment, just treating an individual is not enough. You must have a policy in the society to see that how you are being with the aged population. Actually, later on we will see aged persons are the most respectable entity of the ancient Indian society. Vriddhas are for archanas, Vriddharchana when they say. The wisdom, the maturity they have is much more important. No doubt the workforce is deleted, but what society needs is proper guidance. Their wisdom. In a village person who is very uneducated old man, he has got something to speak to the society, a drop of wisdom. We must have the society, the government policy to tap on that individual to absorb that wisdom into the society. This has to be there with that. This is very much important. We need a policy, government policy here, not just giving pension to the old age persons, not just giving some vitamin injections or some rasayana to their home. No, this is not going to solve the problem. We need to treat the health society, educate the society, not just into individual. This is what I am. So this perspective, what I am telling is the aging is wealth. So we know how to respect the wealth of aging, the aged persons in the society. So this is what I would like to, I even quote that in the Acharya Rasayana also this sloka is there. We have got Vriddharchane Ratham. So you have this, inculcate the practice that how to respect the aged population, how to get benefit out of them. So if we are not able to honor this concept, I do not think we are doing complete aging in the society, in the nation. This is what I would like to say. So in this respect, this is a photo that I have brought when I was there. This is a photo, a famous lake in the outskirts of Bogota in Colombia. The lake is called Guatavita. It's a very famous, that in the history, they were performing, the royal kings, they were all performing as a very famous, a procession which is called as El Dorado. The airport of Bogota is named on this, El Dorado. It is a kind of thing that they were doing in the ancient time. The prince, if he want to become a king, he cannot write down that I have the hierarchy and I can become a king. No, he has to pass through certain processes. He was kept in a dark cave inside by those ancient Vaidyas of this Amazonian area. They call them shamans. So this particularly El Dorado is well known for the kings of Muiscas. There are different communities of there. Still they are in the wild inside. Sometimes when I travel, I try to communicate with them. So this El Dorado is a special ceremony. I am told when I was there there are some interpreters, they told me, the princes, they used to keep it. There are senior Vaidyas treating. They were giving special herbs for him. And they are watching the symptoms coming up. And when they see the symptoms, they only take him out. Why they are doing? They wanted him to more wise, more wisdom and mature. Then he has to do the El Dorado process, and then all the neighbor kingdoms declare, okay, you are the king. This maturity coming through the Rasayana, the kind of things they are doing, it's like a Kuti Praveshika Rasayana. To make even a younger one, prince, to mature, to become a wise king. He was not allowed to contact anybody outside. It is very typical of Kuti Praveshika Rasayana. So this is what I am telling. This kind of community, they have been using certain Rasayanas, and this is the same thing that our textbook talk about. So we have like Acharya Rasayana for the society and the individual. I will not go through in detail, and also specialized Rasayana Chikitsa as per need of the individual. It is not at random. I will not go because it's a conducted and behavioral therapy. You can consider the Acharya Rasayana. I would not go things discussed in a very, how to live with the environment, Acharya Rasayana. How cow, for example, to live with the cow is itself is a Rasayana. We hear when a king, he did not had offsprings, he was asked to live with a cow, to walk with the cow, even in the forest, to feed the cow and drink the milk of the cow. That is it. The special Rasayanas are coming from the very special cow also. They are in Charaka Samhita, they have explained what are the colors, what are the signs of the cow. Samavarna, Jivit Vatsa, the baby cow must be living and having the same color of the mother cow. Urdhva Shringi, and its horns will be straight. And they have explained in the Charaka Chikitsthana, in the Rasayana Pada. And that milk is very useful as Rasayana. And living with the cow and going with the cow and living with the environment and caring the biodiversity, this itself is a Rasayana. So it is not just a pill that you are going to make a research and pop up and you think that I will work for anti-aging. I don't think that will be really good anti-aging. So let us see when the people come, they are going to have the project and how to treat, how to understand. As I told, it cannot be random. There are different age groups and different demands that you should see. Like there could be healthy individuals seeking maintenance support, advice and therapies. This is swasthasya urjaskara. They are not sick, they don't have problem, but they want to maintain. The rasayanas and the therapies, panchakarma is different for them. It is not, you cannot do it and the requirement is different. This group is different, you have the classification. Then there are some aged individuals with minor health problem issues seeking, or willing for a better health and living. This is swasthya parirakshanam. They do not have any diagnosable illnesses, some minor problem, weakness in sitting, as one of them he told that to squat and to get up is one of the important signs to see whether are you aging or not. But the person may not have any illness. So the treatment to such category group is different. Either you give panchakarma therapy or rasayana, that has to be different. Now the third group I am telling, with my experience I am making this grouping, not in the Samhitas, treating the illness of the age. This is where modern geriatrics is coming. This is the only portion where modern geriatrics you can see and correlate. Here you have to take care of the illness in the aged person. Again, their totally different dosage forms and their bal needs to be considered, and accordingly their agni needs to be considered, and accordingly you plan what kind of medicine that can be given or what kind of rasayana. It is vatatapika rasayana that it has to be in, or the person has good bal. You can even give him a kutipraveshika rasayana. So we need to consider. I always say the clinical end point the Vaidya does not consider. What I have to achieve, that needs to be very clear in the mind. If that is very clear, then your prescription exactly it will go in a very precise manner to the target and you will achieve. And this is the Atur Chikitsa that we have. So management of health illnesses in the aged populations, like, it is not just physical, as I told you. You have to consider so many other things, like issues connected with the socio-familial adjustment by this aged population, and issues connected with psychophysical aspects being little bit deteriorated, inefficient in adapting to changes. They are very, very, very thin. As a physician in the clinic, you may miss these points unless you carefully watch. For example, after a certain age, a person, aged individual, may not feel confident to cross the road in the city in India. Whereas 5 to 10 years back, he was very fit and it was not bothering him. But maybe at this age, he thinks twice, okay, can I cross the road or not? Maybe the other vehicle coming from both sides. See, this is adaptability to the society. This is a subtle thing that we can encourage. We have to build up them and boost them some courage to live. We can do with therapies, with some counseling. I would call counseling, mean Ayurveda counseling. Sattva Vajaya is really good. And sitting with the society, community sitting, and I think our friend from Bhutan, he has also put in slide just a spiritual counseling. It is a rasayana, and that boosts and makes more clarity in the mind what I am, what I have to do, what are my response. The responsibility to society will not die. What is my responsibility? Making aware, and this is much important. Along with the rasayana treatment, it is we can do this. The second is management of common illnesses occur in the aged population. There are so many common illnesses, you can choose upon that. And there are so many varieties of treatment, not just treating the illness, we have got even specific rasayanas during the illness, we call it as naimetika rasayanas. So choosing a right rasayana therapy is also very much important when you do it. Yes, it can boost immunity and strength and agility of the system, cooperating and adapting the situation. You can do it Ayurveda treatment standalone, or you can go with the conventional medicine if the person is taking antihypertensive or for the diabetic treatment. Yes, it can go along with us, but we need to plan all the things together. I will not go detail on all of these things. These are the few commonest things which I have found that where Ayurveda can benefit in these conditions, like common neurological problem, brain ischemia and degenerations. We can do something without promising cure. Never make any promise to the cure. Yes, we can support them. Most of them are progressive disorders. At least in my clinical experience, I have seen at least you can stop the progression of the disease. If not, you are reverting back to the normalcy, at least doing some Ayurvedic treatment, we can stop the progression of some Rasayana treatment also we can do. Like Nasya Karma is the one thing I always tell, that is my right hand, that I have practiced in this manner. It's a choice of therapy in conditions of brain ischemias. I will not go very much detail onto this. Like we have common bone and joint problems. It may be a problem to the conventional orthopedicians, but not to the Vaidyas, I always say. If it is a Vata, Kevala Vata, Anavrita Vata, it is not Kapha Samsrishta, Ama Samsrishta Vata, then you always have an upper hand. Just an Abhyanga Svedana can heal the joint pain and make the person back into his mobility. Into the mobility is a great thing that you have to achieve in the aged population. They should come out, they should move, they should interact. Once they are sitting, they are in the bed, it is very, very difficult to retrieve them from the bed. This is where Ayurveda can do a lot of magic. I will not go into the very detail of all the illnesses, but I will talk a little bit on the magic of what Rasayana herbs we have, the beauty of the bioflavonoids that recently our pharmacological, science, modern conventional has found it. Earlier we used to throw it, the fibers, after making we make a 100 mesh sieving in the pharmacy, the fibers are thrown out. Today fibers are jewels. The tannins and the tannoids have been, they are in the international market, they are coming by. Beta-cytosterols, they work like rasayanas, they are from the fibers. So that is what we say, nothing can be thrown out from that with just looking with the glasses of modern conventional medicine. What I say, we have to first adhere, put our grounds standing on the Ayurvedic principle, Shastra, Samhita, see it, Pratyaksha Phala Darshanat, as Vagbhat says, that is the evidence based. You treat, see, that is the best evidence based, document it. This is what Vagbhat says, Pratyaksha Phala Darshanat. And then if you want to speak on something else, yes, bring the conventional medical parameters and then speak in their language. Okay, I can prove in these things. What are the things that rasayana? They can do a lot of things. Anti-stress properties, there are different rasayanas. Anti-aging properties, there are specific rasayanas which are called as Vayasthapaka rasayanas. We have Balya rasayanas, Hridra rasayanas, rasayanas, Chakshusha rasayanas, Tvacha rasayanas. They are not random. They work on specific conditions, specific srotas. If you do not understand using at random, probably you will not get the benefits. We have Medhya rasayanas and so many other. There are rasayanas just for as a relaxant also, and also of course cosmetics also. There are rasayanas for cosmetic purposes, Varnya rasayanas for example, Keshya rasayana. So the purpose we must understand, and then we have to use the rasayanas. So as I told you, it is not just herb or a bioflavonoid which is inside the plant, but how you use it, without intention you use it. This is very much important. So that is the definition of charaka that I have put it here. Labhopayohi shastanam dhatunam rasayanam. It is a labha, upaya, it's a plan that is defined as rasayana, not a herb. This we should understanding. However, this rasayana has a highly specific, affinities towards the senile pathology. That's why Shushruta has made the definition of rasayana is yat jara vyadhi nashanam. When he says jara vyadhi, he is not talking about chronological aging. You cannot stop that. He is talking about biological aging. So this is where we have to throw the light and work more on this. This is one thing which I want to tell within the campus of this university, Trigarbha Kuti. This was built 25 years back. Myself and Professor Gurdeep Singh, we were the two to propose the project. We were asked to put the project by the then Vice Chancellor, PNV Kurup sir, and he asked us to travel down south to Kerala, 2-3 places, and then put up the project. And actually this is put according to the Trigarbha Kuti, according to the Charaka Samhita explanations that has been planned, and it is put. It was the only one model probably you could see anywhere to at least to see how the Trigarbha Kuti is there. Now the situations are a bit changed. There are high-rise buildings around already coming. At that time it was not like that. This needs a little bit of modification now because the surroundings have changed to really use it as a Trigarbha Kuti rasayana. So as I told you, there are different classes of rasayanas. Like Vayasthapana, we have Amalaki, Haritaki, and Guruchi that we have Balya Rasayana also, like Ati Bala, Bala we have got Ashwagandha, Medhya Rasayana to count on, we have Mandakpurni, Vajikarana is Kapikachu, Chakshusha, etc. Now, I will make a little bit of previous concepts that, of course, we say that Rasayanas are best to be used before the onset of aging. Purve, Vayasi, Madhyeva. We are unable to use it. It should have been used. Then after the aging has come, now you swallow Rasayana, it will not work. No, this is a wrong concept. As I have already told you, there are different categories in the aged population. Look into that, you can use it. Yes, even the context, I can quote that particularly in Nasya Karma, in the Prashamsa of Anutaila Nasya practice, Charaka has told, Jiryatascha uttamangeshu jara na labhathe brusham. I will translate the exact words. Jiryatascha uttam. Jiryata means the aging has already started. Where? Uttamanga, maybe in the brain. He says, the aging has started. Jiryatascha uttamangeshu jara na labhathe. The aging process will not gain its intensity. See, this is a very good example, I say. You can use so many things. You can stop its virulence of the senile process. Maybe you can stop the on-marching. The chronological aging will be there, but the biological aging you can hold somewhere to some extent. So, what are the main targeted areas that you can deal with the aged population? On the basis of symptoms, he says, Bhuishtam Vardate Vayu. In the aged population, Vayu will be the clinical target. If in that individual you think that Vayu needs to be treated, then plan accordingly. Go according to the guidelines, clinical guidelines that you get in the patient. Brishyamana dhatu guna praya. The quality of the dhatus, it looks that he is good, built, and looking very fine, not thin, but the quality is gone. So accordingly treat with such things. Then dhatu viveka kshayaha, discretion, agni, the discretional powers of making dhatu is also lost. Then treat those dhatu agnis there. Agni you have to concentrate. Like the sarva dhatu parikshaya, there is total depletion of the patient. He needs more nutrition to encourage the dhatu. The treatment is different. Alparetas and klaiba. Yes, this is where what from the WHO lady also noted this, the sexuality and other things also need to be considered in the aged population. There is enough decrease in bala. You always have to, because they are durbalas, the aged population. You have to take care of bala, and there is support of bala. And sarva kriyasu asamartaha, their performance has been reduced. Do treatment to improve the performance. By giving that, they are no more burden to the society. This is how you can compete. If you do not care them in this manner, yes, they can be sooner become the burden of the society. Not to make the burden of the society, exploit their wisdom, that will be, could be the slogan of the AYUR Zero Mix that I would recommend. That is the best thing that you can do. I will not go into too much of this. Yes, we can deal with the premature aging, morning workers are also there. And timely aging also, we can do something as yapyas. So I have some works done in the past. I will not go into too much of details. I will just display the slides. We have experience, and under the guidance of my own guru, Professor Gurdeep Singh, I was worked for my PhD for the Ayurvedic management of aging. And we tried to see in different parameters how the rasayanas differ. I had a group of Vayasthapaka rasayana and Balya rasayana, and compared how clinically these works will help. We have found they can improve the immunoglobulins, different herbs in different manner also. But the thing that I would like to share is, this is a stress, dynamic exertion stress. I have the two groups, even though some of the Vayasthapaka, Amalika, also Balya. It shows benefit in the dynamic exercise test. It improves in the aged population. Whereas Bala itself, it is a very good. It improves the exertional stress pattern is improved. They gain strength by the treatment of thing. Then we have other recovery pattern from the stress. How fast the systems come back from the stress. That also we have compared with the Vayasthapaka and Balya rasayanas. And also we did that something like cold pressor test that constricts the coronary arteries, and we have found a different way of performance in them. I did the retinal dark adaptation test. There are specific herbs which work on the retinal dark adaptation. This is highly specific to senile pathology. Vaisthapaka rasayanas, they work. And also Vaisthapaka rasayanas, they work in the carbohydrate overload. That is, we are doing GTT earlier, the test. And this stress recovery, I have found the Vaisthapaka rasayanas, they work better. Amalaki works better here. This is also a senile pathology. And also in the renal filtration rate, Crichton's scale for the old age we have done. Collagen index that we did with a skin pinch, how far this pinch remains, and it vanishes faster. We have senior, my colleague, Dr. P.D. Joshi is here. He was helping me. At those times, we did not have computers and photography. He brought from his brother's studio a motor. We had reels, camera in those days, the reel going. He brought one shot, goes in 1.5 seconds that he brought. We made the shotting to see this pinch drop test, how far goes in the youngers, in the olders, after the treatment. Vaisthapaka rasayana showed improvement in this collagen index also. This I want to say that these Vaisthapaka rasayana are having a high affinity towards senile pathology. That means we must select the rasayanas properly. We must fix what is the clinical goal that we have and then prescribe, then only it will be very effective. I will not go into the very detail of the things. So we have a preventive aspects of aging management with management of the age population also you have, and whether we can retard the senile pathology. We cannot say that we can retard the senile pathology, but definitely we reduce the virulence of this. Maybe on marching we can delay. This is possible. This is what I want to. In brief conclusion, that how particularly we have, I emphasize on it is not the individual, it is the society needs to be educated. We need a better health policy concentrating on the age population. If we can do this, these age population will be wealth of the society, and if you ignore them, they will be the burden of the society. So making them self-reliant, senior citizen is an important goal. We have to make them self-reliant, make their mobility good, and their cognitive performance better, than they boost their confidence. This is very much important. We can do with rasayanas, panchakarmas, and other counseling aspects. I will go a little bit faster on these, all these things. So as I told you, the clinical endpoint is very much important. Maybe something has happened to there. Okay. I have only last couple of slides. I will finish looking into the timings. Yes, as I told you, the mode of administering rasayana is also important, that we very much know, the manduka parnya swarasa prayojya. You cannot use like a tablet or churna for the purpose of rasayana. He says, swarasaha prayoja, the fresh juice of mandakorani is only helpful. Kshirena yashti madhukasya churnam. So, yashti madhu churna, yashti madhu we use in so many conditions, but to be as rasayana, you have to use it with kshira. Then raso guduchya to samula pushpya. He says, if you want guduchi as rasayana, then it is from the root to the flowering. That means rasayana activity of guduchi is during flowering season. He has told samula pushpya, then it is. So that's what I told, labhav upayohi shastanam dhatunam rasayanam. Is the method is very much important. I do not know how it is fruitful when we use chavanaprash avalehya at random, to what extent it can help to put it on the bread slice as a chavanaprash gel and you eat it. I don't want to comment upon these practices. Yes, lastly, regarding the research on aging and rasayana, I must insist that the present conventional protocol which we are following to the conventional pharmacology may not fit us. We need to consider our own guidelines and Shastric guidelines for that, and we are doing some effort in All India Institute of Ayurveda since past 4 or 5 years. We have tried to make a software under transdisciplinary research. We have already done taking prameha. We are also doing, Dr. Manjusha is not here, on the retinal care also. We are spreading to other. This gives a guidelines that how Vaidya has to work according to Shastra in diagnosis, and what is the guidelines for Shastri guidelines for Chikitsa Sutra, not just a tablet, nor not just basti giving, the whole Chikitsa Sutra, and then put up a data evidence beta by using this tool, put up a evidence beta and use it as a research for research purpose also. This could probably do something to put up a evidence-based practice. Thank you for hearing. I know it was a very critical time that I have used to explain few things on what actually I experienced, I saw. Once again, I thanks for the organizers to give me this opportunity. Thank you very much.
Thank you so much. Sir has given a comprehensive overview of understanding of Rasayan, which is being mentioned in our classics, and how various aspects of Rasayan can be used according to the requirement. What can be the application of Rasayan, whether it is a Ajasrik Rasayan, or it is a Kamya Rasayan, or it is a Naimetik Rasayan, or it is the part of Acharya Rasayan. So, I think so. Before we move for the comments from the chair and co-chair, if anybody wants to have ask something or there are some queries, it can be put forward. Otherwise, we can move for the next procedure. Yes. We will give you the mic.
Yes, this is a question that regarding Rasayana and treating the aged population that she made. Unfortunately, even without the aging population treating any illness coming to OPD, I never say that one single remedy could be common for every person. Yes, prevention also. Yes, there could be prevention, many preventive, like for example, Abhyanga, Abhyangam Achare Nityam. Every day if you put, they have given Sa Jara Shrama Vataha. It can work as anti-aging. This is a generalized tone. But when you expect real result, when you make a documentation scientifically, you have to see that individual person, what is the requirement, as I told you, whether the dhatu properties are decreased, whether the functions of the dhatus are decreased, and what is the need of the specific individual, and select that rasayana. It is not that you can give everybody Vayasthapaka Rasayana. Oh, I am giving an anti-aging, remedy. It may not help everybody because individual demand requirement is different. Yes. Purush, that is what say. The individual based, it's a tailor-made medicine always in Ayurveda. So that's what Sir now told. Purusham Viksha. Every individual Purusha. And Purusha, as I told, it is not just physical body. Purusha is Indriya, Manas, everything with the soul. So this is the deviation that we get in Ayurveda clinical platform. There is a huge variation, not just Prakriti. How to bring this variation into research platform? That's what I told you. We are doing the transdisciplinary tool, which considered all deviations into the clinical data, and yet you can make assessment. You can say why my Guduchi was not effective to him, but Guduchi was effective to you. I can explain if you do that. This is how we can go. But still there are so many general rasayanas, like Ajasrika Rasayana, just she took the milk and ghee practice. It's a kind of general rasayanas. Again, how and when, in which quantity, this is very much important. If you miss that, if you don't have Agni and you do that milk and ghee, probably rather you're doing harm to that person. It's a good everyday practice, like Abhyanga is there, Pratimarsha. I quoted the slok from Charaka Samhita. This is where Charaka has put Anutaila to use as Pratimarsha. That is where he told Jara na labate brusham. The intensity of aging does not go. But these are all, even practicing Pratimarsha, you may get some patient of dementia and Parkinson. Then you come and ask me, sir, where is Charaka? And he has got dementia and Parkinson. Then you need explanation to whom you have prescribed, in what manner the person has followed, whether the person has passed all the etiquettes that you have advised. These are the things come into action. Otherwise, yes, there are few you can practice as general Rasayana and Panchakarma therapist. Yes.
I think Tamila has got the answer. Simple answer is that if you have a proper Dincharya, Ritucharya, Sadvrit appropriately followed, this is just a Rasayan in a healthy person. And if you have proper good Agni, it is the best of it. So if we understand this in a very simple way, everything is Rasayan if you are using appropriately. Thank you. So with this word.
I'm very happy. I thought that end of the day, I will be talking to the walls, and thank you, at least I am confirmed that I am not talked to the walls. Thank you.
So moving forward, I will request co-chair of the session, Dr. Beraji, to kindly give his comments.
First of all, I think that in this 15 seconds TikTok society, it's very easy to try to have one single measure that will help forever. That's not possible. And I think that for me it's very interesting to know that the country who has the happiness gross product, Bhutan, has this implementing traditional medicine for the happiness. And I think that one of the things that I realized from the Dr. Acharya presentation, the need of the India, and not only India, I think that all the countries, the exception of Bhutan that is implementing, to the aging population, and thus this Jericon just is demonstrating that this is required, and that is also possible through Ayurveda. And I think that Antonio Morandi, all of us know Antonio, he's very passionate, and he also is doing his best for the modern medicine, and always saying that Ayurveda is much more comprehensive than modern medicine. I think that we, with with Ayurveda we have a lot of millennials, but for the Rasayana, for the society, it will be require a lot of action for the next society. And I think that it's also, we must speak not only about herbs, but also about lifestyles, and also for prayers to be very more good people. Thank you.
Now I invite chair of the session, Professor Mahesh Vyasji, for his comments.
Respected guest speaker of this session, Professor S.H. Acharya sir, co-chairperson, and Dr. Dorji, and Professor B.L. Mehraji, Professor Manjusha ji, all faculty members, and dear friends. First and foremost, it is a pleasure for me to be here in this international conference, AYUR GRICON 2025. I am really very Luis Vera with me as co-chair. I am thankful for his warm presence and valuable support throughout the session. His valuable insights and views on the current topic of discussion have given new ideas and perspectives. Thank you, sir. It was my pleasure to share this responsibility. Happy to say that all our esteemed speakers have given excellent talks. Our first speaker, Dr. Antino Moranti, Chairman and Director, School of Ayurvedic Medicine, Milan, Italy, have given wonderful insights on the management of Alzheimer's and Parkinson's disease and issues. And also Dr. Morandi expressed concept of Guna, Mahabhuta, and Tridosha, and some drugs like Vasa, Pipli, etc. Sir, your talk was really very informative and thought-provoking. We truly appreciate your valuable expert opinion perspective that you shared with us. It had added immense value to this session. Our second equally distinguished speaker, Dr. Saurabh Dhorji, Deputy Dean, Academic Affairs, Faculty of Traditional Medicine, Bhutan, shared very informative perspectives on the role of Bhutan's traditional medicine, that is, medical system for the aging population in Bhutan. So your talk was enlightening and full of practical knowledge. We are thankful for your insights and the thoughtful perspectives. Our third speaker, Professor S.H. Acharya sir, distinguished professor at the All India Institute of Ayurveda, New Delhi, of Ayurveda in perspective and value added geriatric care. Acharya sir is having a vast clinical experience, and that we have seen in his deliberation also. Sir have shared with us a very practical and effective ways to explore Ayurvedic knowledge. Thank you, sir, for your exceptional expert opinion. So overall, I believe that it was so much enriching session for each one of us. Each presentation added a new dimension to our understanding of aging and health. I also appreciate Professor Dr. Mandip Goyalji, Dean International ITRA Jamnagar, for skillfully moderated the session and conducting the whole session very smoothly. The session has shown the global strength of Ayurveda. Once again, I would like to congratulate all the speakers, organizers, and participants for making this session so meaningful.
I would now like to request Professor Mahesh Vyasji and Dr. George Beraji to kindly felicitate our speaker, Professor S.H. Acharya-ji. I would like to request all the audience in the auditorium to kindly give a big round for whatever information we have gained in the last few hours. Thank you so much, sir. Now I would request Professor A.S. Baghel sir kindly felicitate our chair of the and Dr. Luis Beraji.
I would also like to request Baghel sir to present the memento and certificate to Professor Dr. Mandeep Goyal ma'am. Thank you, dignitaries on and off the session. I would like to thank each and every one of you as we have come to the end of the plenary session 2 of AYUR Jericon 2025. We'll be dispersing for a short break of 10 minutes. I kindly request you all to be back in 10 minutes. We'll be commencing the cultural events. Thank you so much.